Hello, everybody. This is this year's annual conference of GLO together with JOPE. We see over 3 days highlights from the last issues of the journal. We have a chance to interact with the authors. I appreciate everybody's willingness to join this venture and to have hopefully a very exciting sessions. Now, the first session is chaired by Professor Feng, and he will take over right now.
Okay, thank you, Klaus. So good, welcome everybody to the first session, A1 session, which is the title of the session is environment, climate. And let me see. Environment, weather, and climate. Actually, I found all of these papers very interesting, all related to weather and climate, but they look at very different outcome variables. So let's start from the first paper and the presenter is Wu Jia on compensation for girls in early childhood and its long-run impact, family investment strategies under rainfall shocks. So Jia, you have 10 minutes for the presentation of the paper.
Okay. Thank you, Professor Feng and Professor Zimmerman. Thank you very much for having me here. And I'd very like to share my studies, and the study that was published in Journal of Population Economics in 2023. And the title here, the compensation for girls in early childhood and its long-run impact, family investment strategy under rainfall shocks. And I'm from the Shandong University, and the other two co-authors, the Jia Dalin from the Shanghai University of Finance and Economics, and Han Xiu is from Nankai University, and we are all from China. And this study explores the effect of early life rainfall shocks on the long-run performance of children of different genders in China. In China, as you know, so it's a society there is some more favored by parents. So here from this figure, and we show in panel A, so we show that the blue line means the boys. So in panel A, show that actually boys are breastfeed longer than girls, and panel B show that boys obtain more educational resources than girls. That is so what we call the some preference society, that some can obtain more resources, and because we assuming that some favored resource allocation strategy is based on the expected value of family future income. And this paper answer an interesting question that how parents respond to unanticipated income, which is beyond their consideration when making household decisions. That means because initially the boys are more favored, so they can obtain more resources. We want to ask, so if the family obtain some unanticipated income, and whether the parents use their rainfall strategy or compensation strategy to widen the gaps between the boys and the girls, or narrowing these ability gaps. And this paper answers this question. So we use the birth year rainfall shocks as a proxy for the income shocks, and we found the rainfall in children's year of birth increased girls' long-term test scores and educational attainment, whereas boys are unaffected. That means the rainfall shocks narrowing the ability gaps between the boys and the girls. And when we examine the underlying mechanism, we found that in years with more rainfall, mothers work fewer times in agricultural works, and girls obtain more health insurance in positive rainfall years, indicating that the rainfall shocks are associated with an increased willingness of parents to invest in girls. That means the parents actually use a compensation strategy. And we also find some very interesting results to explain why parents use this compensation strategy. We examine the parents' attitude toward the son and the girls. We find that the parents in more rainfall years, actually parents are less likely to agree that raising children is to provide support for themselves in old age. So this variable is used to measure the son preference attitude. That means the rainfall, the unanticipated rainfall altered the parents' attitude of son preference attitude. So our contribution mainly we contributed the existing literature in the following 2 ways. The first literature we released the first strand of literature focused on the long-run effects of rainfall on children's outcomes. We improve on this literature by providing a deeper insight to the potential mechanism and answer why parents are likely to compensate girls in years with more rainfall. And the second contribution is we answer to whether under which condition the household would like to adopt a compensation strategy between children of different gender. We find that the parents tend to compensate girls when they experience a temporary and unanticipated positive income shocks. So this our finding has silent policy implication. So although China, has promulgated a series of laws to mitigate gender inequality, but we find that women still receive lower wages and have limited promotion opportunities and actually have shorter educational years of schooling. Hence, determining under which condition parents would like to make up for the gender difference is very important. Our study showed that the policy that aims to motivate parents to treat boys and girls equally should be formulated at the initial stage of children's development. So that's why we studied the rainfall shocks in children's birth year. And so because this is more efficient for future human capital accumulation. And the second is the policies that aim to narrow gender gaps should provide subsidies that are beyond people's expectation. That means if we want to provide the subsidies or money to families, and if the policymaker want to narrow the gender gaps, you should not let the parents know before the policy come into the effect. So only under this condition, we find that the policy, the parents would like to use allocate this extra resources to girls. And so future works could extend our study from the following 2 aspects. So that means so why we think our study can be cited by the future studies. We show that the parents adopt a compensation strategy when they obtain income that is beyond expectations. We use rainfall shocks as a proxy for the transitory income shock that is beyond their expectation. I think future studies could offer additional evidence to support this discovery. And the second is we find a very interesting result that actually the parents' attitude or parents' preference can be molded in the exposure to the income shock. That means that the rainfall shock can shift the parents' attitude towards their daughters. And I think this is a very promising but very preliminary findings. I think future studies could continue to delve into these issues by providing more evidence in other countries or circumstances. So this is all of my presentation. Thank you very much. And any comments are welcome. Thank you.
Thank you, Jia, for the presentation. I have a question. So regarding the finding and the interpretation of whether this is compensating or reinforcing girls for their disadvantages because of the existence of some preference, can you I found this very interesting that you said because of the rainfall shocks are related to unexpected income increases, so they would like to compensate for girls' disadvantage. So suppose the income increases, expected income increases, would the parents still compensate, or they would invest in boys? Or next question related is why the parents would compensate only with unexpected incomes? I mean,
okay.
What is the parents' utility function like? How? Yeah, can you say something about this? Yeah.
Thank you for your questions. And yes, because I think, yeah, first of all, so our study only shows that the rainfall shock as an unanticipated income would lead the parents to use the compensation strategies, but we cannot answer to whether the parents use the similar strategy if they get the income in advance, and if they know before the shock come into effect. But from the assumption of the most of literature that the parents actually use, figure out the strategy before under the condition that they find that that means the parents formulate the strategy according to the lifetime income. That means the most of the existing literature assume that most of the strategies are made under this condition. That means the people know their lifetime income, or they create the strategy based on the long run income. This is the assumption adopted by the most existing literature.
Thank you.
I think the future.
Yeah, please.
Yeah,
please
I think future studies can go on with this issue to check whether the parents adopt a similar strategy if they get they know the income in advance. But I think most of people's plan created based on your long run expectation, right?
Okay. Any other questions? Yeah. If not, thank you very much, Jia. Because of the time constraint, maybe we should move to the next speaker. So
okay, thank you very much.
Yeah, thank you. So the next paper is the mobility costs of air pollution through the lens of health spending in China. And we have Shuaizhang presenting the paper on behalf of the co-authors.
So thank you, Professor Feng. So I'm Shuaizhang from Beijing Normal University, and the paper I will present today is the mobility costs of air pollution through the lens of health spending in China. The paper is co-authored with my colleague Zhang Xun from Beijing Normal University, and Liu Yuehua from Tsinghua University, and Zhao Xintong from Renmin University of China, and Chen from Yale University. Okay, first I will talk about our paper's motivation. So our research is motivated by the increasing body of literature in economics that explores the impact of air pollution on health-related outcomes, such as morbidity, mortality, hospitalization, and birth outcomes. However, there remains a relatively limited understanding of the causal effect of air pollution on medical expenditures. Identifying causality is crucial due to the endogeneity problems associated with examining the impact of air pollution on health spending. These problems arise from unobserved factors, avoidance behavior, residential sorting, and measurement errors. Besides, the significance of studying the impact of air pollution in developing countries cannot be overstated, giving generally higher pollution levels and poor health status compared to more developed nations. So our study estimating the dose relationship between air pollution and medical expenses holds potential implications for other developing countries facing similar situations. So our paper contributes to the literature in several dimensions. So firstly, unlike most existing studies, relying on insurance claims data that excludes drug expenses at pharmacies, our data set includes detailed information on transactions from pharmacies, clinics, and hospitals. This enables us a comprehensive examination of the impact on outpatient health spending, including pharmacy expenses. And secondly, evidence on the healthcare costs of air pollution for young children is limited. So our sample covers all age cohorts of urban residents, allowing us to test the heterogeneity in sensitivity to air pollution across age groups. And thirdly, previous studies either rely on aggregated health spending data that is subject to ecological fallacy, or disaggregated data from social surveys, which may suffer from recall error. So our use of individual level data allow us to control for individual fixed facts and test the heterogeneous effects across groups. So moreover, we contribute to the literature on estimating people's willing to pay for improved air quality based on the fourth method is here. And the first method is hedonic approach, which is suffer from omitted variable problems. And the second method is CVM, which suffer from the static responses. And the third method is Hatton approach, which is a which use cardinal utility. So I think our paper contributes to the literature using the fourth method based on the marginal effect of air pollution on health spending. And okay, so let me introduce how we construct the data and our main methods. So we construct a panel data by aggregating the health spending data from a basic medical insurance problem in a major Chinese city in Wuhan, at the individual month level. In cases where no health expenditure records exist for a specific month, we assign a value of 0. So we focus on two dependent variables. The first is the total value of health spending, and the second is the number of hospital visits and pharmacy purchases each month. So we instrument PM2.5 concentrations use thermal inversion to address potential endogeneity in air pollution. And also we estimate people's willing to pay for cleaning air based on the marginal effect of air pollution on health spending. So the EV estimate in our paper suggests that a 10 microgram per cubic meter reduction in monthly PM2.5 leads to a 3.04% decrease in the value of health spending and a 0.9% decline in the number of transactions in pharmacies and health facilities. And the effect is largely driven by spending at pharmacies and more salient for males and children, as well as middle-aged and older adults. So as our estimates provide a lower bound of people's willing to pay, which amounts to 43.87 Chinese yuan, or $7.09 US per capita per year, for 10 microgram per cubic meter reduction in PM2.5. So finally, let me summarize the highlights of our paper. So our study is one of the first to present causal evidence of the morbidity cause of PM 2.5 for all age cohorts in a developing country. We rely on disaggregated data at the individual level from a basic medical insurance program in a major Chinese city, and we instrument PM 2.5 concentrations using thermal inversion to address potential endogeneity in air pollution. Finally, we estimate people's willing to pay for cleaning air based on the marginal effect of air pollution on health spending. So to conclude, so we invite you to read and cite our paper. So thank you for your attention.
Thank you very much. Any questions from the audience?
So may I have a question? So, so you use your daily data to measure the PM 2.5 or yearly?
Sorry, daily data. Yes, daily data.
Daily data. So
yes, but we aggregate the daily data to monthly level because our data is aggregate at the individual month level. Yes.
Okay, so the underlying assumption is that the family or the household know exactly the PM 2.5 every month.
Oh, I think this mirrors the exposure, not the exactly they know, right? So we just estimate the exposure to PM 2.5 on their health spending.
So I think only if they know the PM 2.5 and they will change their strategy.
Okay, so I think there's may some physiological mechanisms, right? So the PM 2.5 could affect your health. Yeah.
Okay.
So maybe you'll feel sick and you will go to the hospital or go to the pharmacist to purchase some drugs, right? So also between the sample periods, I think everybody cares about air pollution. It's from 2013 to 2015. Yeah. Yeah, this is the time period. As during this period, everybody cares air pollution in China. Yeah.
Okay, can I also ask a question, Xin? So you you mentioned that this is this is like a lower bound for willingness to pay, right? Have you compared this with other results based on other approaches for estimating willingness to pay for the reduction of PM 2.5? I mean, do you have a you should have a lower estimate, right? So how does those compare?
Okay, so we have a table in the paper.
Oh, okay.
Yeah.
Okay.
So our estimate is lower than other methods, but our estimate is higher than the US estimates using the same method. Yeah, this is our conclusion. Yeah, I cannot find the table. Maybe in the appendix.
Sure.
Yeah.
Sorry. Yeah. So, what is the cost of reducing PM 2.5? So this can be considered as the benefit of lowering PM 2.5, right? Have you compared this with the possible cost of reducing PM 2.5? Like if you burn less, carbon.
So we only estimate the benefits, not compare with the cost. Yeah, I think obtaining the cost information is a little difficult. Yeah.
Yeah, I mean, it's beyond the scope of your paper, but I mean, have you noticed of some kind of estimates or best guesses? There must be someone studying how to lowering right? What is the economic cost of reducing pollution, right? Is there any number? No. Okay.
Yeah, no, sorry.
Okay, good. Okay, thanks.
Thank you for everything.
Okay, so we still have some time. If anybody has any questions. Okay. Okay, if not, then maybe we can move to the next paper. Thank you very much, Xin.
Okay, thank you, Professor Feng. Thank you for everybody's attention and comments. Yeah, bye.
Okay. Okay, so the next paper is the effects of temperature on mental health, evidence from China, presented by Professor Yue Hua.
Okay, thank you very much. Let me share my screen.
Sure.
Dr. Zhang Xin, could you please close your screen sharing? Because I can't share my screen with yours on.
Okay, sorry. Let me
no
try
problem.
to.
Yeah.
Okay.
That's fine. Yeah.
I'm so sorry.
Yeah. Okay, thank you very much. All right. Okay, can you guys read my screen?
Yes.
Hello?
Yes.
Okay, thank you.
We can.
Okay, thank you so much.
You can see.
First, let me thank you, Klaus. Thank you, Dr. Feng Shuaizhang, for organizing this great event and having this opportunity to present our published paper. This paper is a joint work with Qiu Yun at Jinan University and Tan Xiaoqing, who was my master's student and now is a PhD student. Basically, we are looking at the effects of temperature on mental health, which it's not a brand new idea, but I think we have made some innovations in this paper in several dimensions, which I will present here. So the first, why we still think this topic is important, is that you can see that mental disorders are still placing health burdens, okay, on both developing and developed countries. It's a global concern. And the second is identifying the influencing factors of mental disorder is still important. It is essential to the treatment of mental diseases. We think understanding these the influencing factors of mental health helps to improve the social welfare. And lastly, we believe that the climatic factors can be increasingly influential in shaping the global distribution of mental health. Since we are living in the era of global warming, we are talking about climate change and greenhouse gas, stuff like that. So we are it is almost for sure that people's mental health and the related welfare will be increasingly influenced. So here, the next I will show you some of the basic findings of our paper is listed here. First is that we find higher temperature over 30 degrees significantly increase the likelihood of depression, which is the main symptom of mental disorder in this paper. So we focus, we focus on depression using the measurements, okay, given our data. And the second is we made some heterogeneity analysis based on different cohorts. We split the people by their age, by their gender, by their educational attainment, and also by their occupation. And we do find that the mental health effects of the high temperature deviates among these different cohorts. So the third findings of this paper is that we try to identify some of the mechanisms underlying our identified effects. So the first mechanism we find is the incidence of the physical illness and the second one is the sleeping time. Okay, and I think we also tested for other channels, but they seem to be irrelevant. And the fourth finding is we try to make some analysis on the adaptation behavior. Okay, so basically we test, is there the moderating effect of air conditioners, and I think we also test if like the locals are more adaptable to the compared to the non-locals. And we do have some tables on that in the paper. If you're interested, you're more than welcome to read. And lastly, we made some projections, okay, and predictions. And we find that the mental health will keep on deteriorating in the midterm and in the long term if the government does not provide a proper intervention. And so that would be the main findings of this paper. The contribution of the paper is threefold from our perspective. So the first is, I think we are among the first to examine the causal effects of temperatures on individual mental health. I think it's among the first that we provide evidence using nationally representative data from a large developing economy. Okay, we do have evidence from the United States, from some of the main countries in Europe, but to the best of our knowledge, this would be the first paper using representative data in China on this topic. So the second contribution would be, I think our study contributes to the literature on the health impacts of the climate change, which of course is a large has a large amount of papers already. But I think we supplement this branch of literature by revealing the underlying mechanisms, by presenting results from idiosyncratic cohorts, and also by examining the effectiveness of assorted adaptation measures. And at last, I think we highlight the importance of climatic condition as an influencing factor of mental health. Okay, so both at present and in the projected future. So as the temperature goes is raising consistently, I think the research on the natural conditions, especially the climate change, the relationship between climate change and its health outcomes, would be increasingly influential and also necessary. Okay, so at last, I think it's quite interesting that we do some advertisement on our paper to. So why should this paper be cited? For labor and health economists, please cite our paper if you need evidence and explanation on the determinants, especially natural determinants of mental health, if you are doing these health and labor studies. And for environmental economists, you can cite the paper if you need evidence and explanation on the socioeconomic impact of climate change, greenhouse gas, and temperature. Okay, and at last, for the natural scientists, okay, if you may also be interested in this paper if you are working on the related topic and try to understand this issue from a rigorous causal perspective. Okay, so that would be a very rough and quick summary of this paper, and that would be my presentation on this paper. Thank you very much.
Thank you, Yue, for this presentation. Yeah. Any questions from the audience?
So I have a question. I live somewhere hot, Florida, and we always say down here, it's not the heat, it's the humidity. Because it
Okay.
doesn't cool off much at night. And so I found this paper, all of these papers are interesting. This one's interesting to me in part thinking about the lack of sleep as leading to people being depressed and other mental health issues. And so I'm curious if you have thoughts on whether it's the temperature or the lack of cooling at night because of humidity.
Yeah, that's actually a great question, and I think we have met that question in the from one of the reviewers. It's quite similar to your question. I think the ways, if I'm not getting it wrong, we dealt with two ways to rule out this possibility. It could totally be possible that the humidity is in operation, but first we have the humidity controlled in our model. Okay, so that's the first. We have it controlled in all our models. And the second, besides using the number of days of the high temperatures, we also look at the minimum temperature and the maximum temperature. So if it's in the night, basically maybe we are talking about the minimum temperature, right? So we will also take a look at the effect of the minimum temperature in the day. And the third, I think, another treatment of this problem is yeah, that's the two responses I can think of now to your question.
Okay, so basically it's not the hotness in the night, right? It's in the days.
Yes.
I see.
Because we have look at the average temperature of the day and the maximum temperature and also the minimum temperature. And also the nighttime temperature is basically the minimum temperature. Right.
Okay.
Yeah, and the result stays robust.
Any other questions? So in terms of the magnitude, the importance of temperature as a determinant of mental health, how does that compare to other determinants of mental health? I mean, is it important from a mental health perspective? Suppose I'm someone who is interested in mental health, and there are a number of many different factors affecting mental health. How important is temperature relative to other factors in practice?
I think you really raised a important question, but maybe that's something we haven't been discussing in this paper. We haven't been able to provide a comprehensive comparison among all these determinants of mental health. But I think that's a very good point. Is here we can just say, okay, it's an influencing factor. It affects like a considerable amount of the measures, the CESD scores here. But yeah, honestly, we can't say that it's more or less important than other determinants. Yeah, but we should definitely look into that if there's any chance that we do a related work in the future. Yeah, thank you.
Okay, thank you.
Okay.
Okay, we still have some time in case anybody has any questions.
No, I have also a question. Yes.
Okay.
Yes, my name is Joseph.
Hi, Joseph. Hi.
Hi. My question is about samples. I have samples from hospitals, maybe to have something tangible, something real, so that we can compare to the temperature effect. Is there any any sample you used during your research. Thank you.
Oh, okay. You mean using the samples in the hospitals, like the patients?
Yes.
Yeah, that's something to think about. I think,
yes.
yeah, but unfortunately, we don't have specific data on the patients, especially I'm to my knowledge, I don't know if there's even accessible data or publicly accessible data in China that we can look at the actual mental health status of the patients in hospitals. But yeah, I totally agree with you that if we can access to data of that accuracy, it would be a great improvement to this analysis.
Yes, because sorry, sir. Yes, because your country have data set. I know because you are.
Yeah, because this is right. This is I think I have two responses to these change in data. The first is it's an improvement by sure, because now we are just asking people, right? We're just asking people, how do you feel in the past months? But if we look at the actual clinical data, medical data, they are more objective, right?
Yes.
But I think the second thing you need to worry about is the hospital is a little bit different from the general environment, right? That's something you need to worry about if you just look at the patients in the hospital, because they can be systematically different from a general public, right? So that would probably compromise the representativeness of the sample. Yeah, but that would be a good thing to try. Yes, I agree with that.
Thank you so much.
Okay, thank you, Joseph. Thank you.
Okay, great. Thank you, Yue, for the presentation and for the questions. Now let's move to the last paper of this session. Gendered effects of early childhood weather shocks on locus of control. Evidence from 28 agricultural countries, presented by Masahiro Shoji.
Okay, so can I start? Can you hear me?
Yes.
Okay.
Please.
So thank you for giving me this opportunity, and thank you for coming to my presentation. And I'm Masahiro Shoji from the University of Tokyo, and the title of this paper is Gender the Effect of Early Childhood Weather Shocks on Locus of Control, Evidence from 28 Agricultural Countries. Okay, so basically this paper is related to the literature on the fetal origin hypothesis. So the broader question of this paper is to look at the impact of early life circumstances on adult outcomes. Okay, so as you know, there are a bunch of papers looking at the similar question, but this paper has some unique features. First of all, so I'm going to look at the impact of nationwide weather shocks on adult locus of control, which is a type of non-cognitive skills. And the locus of control is the belief that I can control my life outcomes. Or we can also say that it's a perceived returns to effort more intuitively. And the second feature is the high external validity, because in this paper, I combined the multiple waves of world value survey in 28 agricultural countries from 1981 until 2020. And number three, the usage of such repeated cross-section data allows me to identify how many years the impact of weather shock persists. Okay. And using this data, I found that the impact for women persists even longer than for men. And finally, in the mechanism analysis, I provided the evidence on the channels through the declines in the parenting quality, especially the increases in the physical punishment by parents. You know, the previous papers mainly looked at the channel through the education and health, but this paper provides another channels. Okay. So let me talk about the details. So the data set comes from the world value survey from wave 1 to wave 7. This is the main dependent variable. And for the treatment variable, I use a country level annual rainfall and the temperature since 1950s. And after combining this data set, I restrict the sample to 28 agricultural countries because the main treatment variable is the weather shock, and especially the rainfall shortage. And the sample size is over 87,000. And this map shows the geographical distribution of my sample countries. As you can see, it includes Asia, African, and South American countries. And using this data, I estimated this model, simple OLS, and the dependent variable is the locus of control in adulthood. And the main treatment variable is the weather shock in childhood. And also control for the individual characteristics and a bunch of fixed effects. Okay. And the results show that, so this table shows the main results of this paper. And in column 1, I find that exposure to the rainfall shortage before age 5 negatively affects adult locus of control. And the column 2 shows that the impact is even larger for women. Okay. And in this figure, I looked at how many years the impact persists. Okay. And the figure showed that during the teenagers, I didn't see any gender gap. The magnitude of the impact was comparable. But after that, I found some interesting differences. Okay. And for males, the impact diminishes by their 20s. So it disappears immediately. But for females, it persists even longer until they're over 50s. Okay. And also, it's not in this slide, but I also looked at the impact on behavioral outcomes, political participation. And I found that the negative impact of rainfall shortage on the female political participation, such as voting and other political activities. So this behavior pattern is consistent with the main results because our conjecture is that those with poorer locus of control should be less likely to vote because voting, they should believe that voting wouldn't change their lives anyway. And finally, in the mechanism analysis, I tested several mechanisms, including health and education, but these channels could not fully explain the gendered impact on locus of control, although I still found some consistent patterns. And plus, I also looked at the mechanism through the change in the parenting quality. And I found that women who are exposed to the shocks before age 5 are more likely to justify physical punishment against their children. And these findings provide suggestive evidence on the channel through the decline in parenting quality during the weather shocks, because the literature suggests that the victims of physical punishment in childhood are more likely to commit violence against their own children. So this prediction is consistent with our observed pattern. And finally, let me wrap up. So using the World Value Survey data, I found that rainfall shortage at the preschool period has persistent negative impact on females' locus of control and political participation in agricultural countries. And the potential mechanism could be a decline in parenting quality during the shocks. And also, I conducted some decomposition analysis, and I found that rainfall shortage in early life explained the 21% of gender gap in adult locus of control, which is quite large. And these findings could be very important for policymakers because in agricultural countries, improving the accessibility of disaster prevention infrastructure, weather insurance, and disaster relief programs may be effective in developing individuals' non-cognitive skills. Although the literature mainly discussed the role of child care and education program. So this suggests that effective policy intervention could be different between the developing countries and developed countries. Okay. And these findings also make some contribution to the economics literature. First, recent studies explain the gender gap in socioeconomic outcomes like wage by their difference in non-cognitive skills. But the problem is that the sources of gender difference in non-cognitive skills are not well understood so far. But this study demonstrates the origin of gender differences in locus of control, which could be a large contribution. And the second point is that the literature has demonstrated that negative shocks in childhood affect adult socioeconomic status, mainly through the decline in education and health. But in this paper, I provide evidence on the other channels through the parenting quality and the locus of control. The weather shock in early life could affect adult socioeconomic status through locus of control as well, or parenting quality. So the future research should also address these potential mechanisms. So that's it from my side. Thank you very much.
Okay, thank you for the presentation. Any questions from the audience?
Hi. Okay, thank you very much, Shoji. I just want to understand, well, what exactly is the reason for the parental decline? Is it due to disruptions in the household income, or is it disruptions in the employment? What exactly what exactly is causing the parental quality decline?
Okay, thank you for asking. So according to the literature on child development and psychology, the potential channels could be the mental stress of mothers. The poverty is significantly associated with the mental health, or the mental stress of parents, and this could trigger the physical punishment against their children. Did that answer your question?
Yes, it did, but I'm still wondering, is it okay, like you said, due to mental stress, but that mental stress is, of course, I'm sure you are tying it to the disruptions in weather pattern now, but is it is this stress due to, for example, its effect on their agricultural income or agricultural produce? I'm talking about based on your context now.
Thank you. Sorry. So I'm thinking about the loss of agricultural income, because in my main specification, I also looked at the impact of the other types of weather shocks, like flooding or high temperature, low temperature, and the rainfall shortage significantly affected the GDP, agriculture GDP. And then the other types of weather shocks, like flooding and temperature shocks, did not affect locus of control. This means that the decline in the agricultural income should be the main channel.
Okay, thank you very much, Shuji.
Thank you for asking.
Okay, may I have a question? So, hello?
Yeah, thank you.
Hello, may I have a question? So you just mentioned that the women are more likely to commit the physical aggregation toward children. So you said, I remember that you mentioned that it's a possible mechanism, but you just said that actually it triggered. So the temperature or the rainfall triggered, the women are more likely to conduct this physical punishment. So it is a possible mechanism, or it is a result. And my second question is that, so I wonder that whether your results are driven by the fact that the women actually have more time to be with children. So yeah, you know that your fathers are more likely to work outside.
I see. Okay, so sorry, I couldn't understand the first comment, but let me address the second point first. So unfortunately, the World Water Survey doesn't have the detailed information about the retrospective information, right? So it is very, your suggestion is very interesting, and there could be such kind of patterns, mechanism, but so you're suggesting that during the rainfall shortage, mothers should be more likely to stay at home so they can stay more with their children, so they have more opportunity to commit violence.
Yes.
Right. Yeah, but okay. In order to test this possibility, maybe I can look at the heterogeneity across the agriculture patterns, because in some cropping patterns, the negative shocks in agricultural income can actually increase in the time allocation, time allocation for income earning activities in the other types of jobs for women. So that's a very interesting conjecture. So I can maybe look at the hypothesis using some heterogeneity, although I don't have the data at hand now. And so, sorry, I missed the first question.
Yeah, my first question is, I just wonder that, so you said that women are more likely to commit the physical punishment toward children. This is the mechanism, or this is the resultant of the weather shock?
What do you mean, mechanism or the results of? So what I'm thinking is the weather shocks, like rainfall shortage, drive the physical punishment against children, and this in turn negatively affects local control.
And then cause the women had a lower level of non-cognitive skills.
Yes.
So I'm a little bit confused here for the how to relate your story to the finding on gendered effect. The gendered effect says that girls, right, not their mothers, are more likely to be affected and to have a persistent effect. But in your story, it seems to be on, mothers, not the girls, right? So why the parenting, parenting style deterioration affects girls more than boys?
Yeah. Okay, so ideally, in order to test the channel about the parenting quality, I should have had the respondents' experience of physical punishment in childhood. But unfortunately, World Value Survey doesn't have such information. But instead, the World Value Survey has the information about the attitude to justify the physical punishment. Right. Then the literature suggests, psychological literature suggests that the victims of physical punishment in childhood are more likely to commit physical punishment against their own children. So the victims of physical punishment are more likely to justify the physical punishment against their own children.
But are the children girls or boys? More likely to commit?
No, that doesn't matter.
But the effect, you have a gendered effect. I don't.
Yeah, but okay. So I found the association between the weather experience of weather shock in childhood and just justifying the physical punishment against their own children only for female respondent. This means that female could be exposed to physical punishment in childhood.
I see. Okay.
Did I address the question? Now is it clear?
Yeah. Yes, it's clear. So I see. Yeah, I see. Okay.
Yeah, because of the data limitation, it's kind of tricky.
I see.
I understand the point. Yeah.
Thank you. Yeah, I see. Okay, so we are right on time. So let me thank everybody for the presenters and all the participants for participating in this session. Klaus, do you have something to say to conclude our session?
Yeah, thank you very much. It was a lively and nice start of this event. And I think we can round up now. As you may know from the program, we have now a half-an-hour break. So anybody who would love to go on, please come back. The others, well, goodbye and see you somewhere else. And we are waiting for anxiously now for the next round. So in 30 minutes, we restart with the next session. And I will put on the program of that next session in a moment. Thank you so much. I'm closing the session and pause here. So everybody, welcome back to the second round of the GLO-JOPE conference. The session is on health, vacations, risky behaviors. The chair is Chen, so please, go ahead.
Thank you so much, Klaus. And this is, if you just join us now, this is the second session of the GLO-JOPE Global Conference. And we are in the second session called Health, Vaccinations, and Risky Behavior. So we have 4 fascinating studies freshly published in Journal of Population Economics. So we would like to invite the authors to present their results, findings, implications, and discuss with audiences. So without further ado, let's introduce. The first speaker is Dr. Yarian Fawaz. She will present on behalf of the co-authors about the first paper on social isolation, health dynamics, and mortality.
Thank you, Xi, very much for introducing the paper, and thank you for being the editor of that paper. It was a great referring process, and we're very happy that it found that great home. So thank you, Klaus, also for the invitation. So can you just remind me, it's 10 minutes me talking? Yes, okay, perfect. So I will just check that I'm not, because 10 minutes is complicated, right? So I'll do it. So as you just said, so this is a paper about social isolation and health and mortality using the shared data, so in 21 European countries. So we were asked to think this way, right? What's the issue in the paper? So what's the issue? That's a good question. So the issue is about social isolation and health. So is social isolation bad for you? Before we go into this research question, the first question is exactly what is social isolation? So who is socially isolated? Am I, are you? That's the question. So we have 3 very easy questions. Do you live alone? Do you not see your children often? Or maybe do you have no children? And do you not participate in any associations such as a political, sports, or volunteering community? Well, if you answered yes to any of those 3 questions, then you are socially isolated, or so are you, according to a large body of research and according to our research, since this is the definition we chose in this paper. So basically, if you live alone, if you don't participate to anything, to any kind of club or association, and if you don't have children or if you don't see them often, then you are what we call socially isolated. And why should you care, or why should we care about that? Well, it seems we really should. And why exactly? According to what you can read in the press those days, this is how this has been relayed very widely. Basically, being lonely or being socially isolated is associated to smoking, is similar, is akin to smoking 15 cigarettes a day, which today we all know what it means for your health. So it's very bad. In the literature, social isolation has been associated with high blood pressure, heart disease, obesity, a weakened immune system, anxiety, depression, cognitive decline, even Alzheimer's disease, and of course, mortality, death. So our research question is that one. Is it really social isolation? Should we blame social isolation for this? There is a big literature in epidemiology, in medicine, in genetics, and there are a few meta-analyses that are very valuable because they show that the conclusions are always very similar. So in that one, the one by Holdenstadt and others, and co-authors, it's about 70 papers with 7 years follow-up. And what it shows is that being lonely or being socially isolated is associated to an increased chance of dying over the follow-up period of 30%, which is huge. Now, of course, what happens in that literature is that there all papers are not of equal quality, and all papers should not be taken in the same way when the press reads it and relays it to people. So this is a bit our concern, and this is why we started that paper. Many of those papers are 100% unadjusted analysis. There is no control whatsoever except for gender or maybe age. Some do a good job. They have controls. They introduce covariates, but the one they have. And the thing with those studies usually is that there is no background data on people. We don't know where they come from. We don't know who they are. We don't know about their childhood, about their parents, right? And also, this is not a random sample. Usually they enter a hospital. So it's the kind of a very selected sample that exists. So what we have to compare ourselves to is not really to those papers, but to those that exist that exploited data sets such as the Health and Retirement Study in the US or ELSA in the UK. What can we add to that literature? There is one paper concretely that we consider is the best in the literature that uses ELSA, and what they do is that they control for health at baseline, and we think that this is key. And then they look at the effect of loneliness and social isolation in a few years, and they show an increased probability of dying over the follow-up period. What can we add to that paper? So we have 3 points that we want to talk about here. First, it's a very rigorous analysis. It's the same kind as in the paper I just mentioned, but we have a very long follow-up period. We have lots of controls, including about the childhood, about retrospective life histories and these kind of things. But also what we have is that we have a multi-country framework. And what we uncover is heterogeneous effects of social isolation across countries. And what is very important here is that the experience of social isolation in Eastern countries looks like much worse than in other countries. Second point is that we look into channels. Why does social isolation affect mortality? And we look more specifically into health behavior, healthcare utilization, loneliness, and having a poor social network, which is also a specificity of share that wasn't present in the other data sets as potential mediators. And last, we do what we call value-added models. This was suggested by a referee, actually, and we liked the term. And what we do is that we look into the effect of baseline social isolation on later health, many dimensions of health. We look at the health as a multifaceted concept, and we look into cognitive health, mental health, frailty, functional health, and so on. And what we do is that every time we do that, we make sure we control for initial baseline outcome, the outcome when those people enter the study. This is what we call it value-added models. Now, exactly what do we find? What do we find? We find the same thing as in the literature in general, a kind of 20% increased mortality hazard when you are socially isolated. These are all of those coefficients. It doesn't matter what kind of control you add, it just gets more or less bigger, or I would say stable, around 20%. So basically, if you're socially isolated, your chances of dying over the follow-up period is 20% higher. Now, what happens when you differentiate, when you introduce heterogeneity between 4 blocks of countries, Western, Southern, Northern, and Eastern? What happens is this hazard ratio of 1.20, you have to re-multiply it by another 1.20, which means more or less a 45% increase this time. So it's really a lot. What is not in the paper is that what I know is that this was even more if we don't integrate the data post-COVID. But we took into account the whole data, meaning including until summer 2021, and this is what we get. But it was even worse actually in Eastern countries before. Now we looked into many channels. What we will check is the role of those variables as potential mediators: loneliness, social connectedness, health behavior, and healthcare utilization. All of those, they really seem to matter. When they are introduced in the Cox regressions, they have a similar impact on mortality as social isolation. This is the case for loneliness and social connectedness in particular. And of course, if you look into health behavior, if you take smoking, for example, into account, of course, the hazard ratio is like 180. This is huge. But what happens is that it takes away very little of the explanatory power of social isolation. So it doesn't seem that this is a major driver of the social isolation effect of mortality. And then what we do, sorry, I'm checking the time. Yes, is that we do those value-added model. This is a bit complex to understand so quickly, but each point on each graph at each point of time is a regression, and each point is the coefficient of a regression of future health on baseline social isolation. Since we control for the outcome at baseline, this can only show a variation. So when there is a positive coefficient here that is not zero, and this is significantly higher than zero, it means there is a deterioration across that dimension. So basically, there is, for socially isolated individuals at baseline, we can see a deterioration of frailty, of self-assessed health, and also on limitations, and even and quite stable over time, which means that it keeps on worsening of cognitive decline. So it seems that there is a very strong effect that keeps on building up of social isolation and health. We do the same with health behavior and healthcare utilization. And also here we can almost say there is nothing happening on healthcare utilization. This is actually a result. It means that while social isolation keeps on worsening your health, even controlling for baseline health, you are not going more to the doctor. You're not taking more drugs. So this might actually be a channel through which social isolation affects your health if you're not using more healthcare. Is it because you are socially isolated, so you don't have many friends and you're not going out and nobody can take you to the doctor? This is a possibility. Last, we do an exercise that we think is quite unique in this paper, that we try to quantify the impact of each mediator. We look at how a mediator impacts mortality and how social isolation impacts that mediator. We do a kind of chain rule calculation, and what we show is that we can explain up to 13% of the effect of baseline social isolation and mortality. And this by only the impact of social isolation on increased frailty, reduced cognitive function, and increased smoking. So basically, why do we think you should cite our paper? Well, we like this paper. We're very proud of this paper. It's kind of descriptive. There is no very strong identification strategy because we don't think this is a possibility with this topic, but we think it's such an important topic, and the analysis was done so rigorously that we think it is worth citing when we think of social isolation, health, and mortality, because we try to quantify things, we try to explain channels, and we provide evidence of heterogeneity between across countries that was not present elsewhere to our knowledge. Thank you very much.
Thank you so much, Dr. Ferris. It's a very highly important topic, especially we just came out of the pandemic after a few years of lockdown and restrictions. So let's open the floor for discussion. Is there any questions from the audiences? Yeah, perhaps I can take the privilege of being the chair of the session to ask you a question about other potential mechanism. You investigated a number of important potential mechanisms, but did you think about other potential channels, like the economic channels, like how that goes through the impact on the labor market that affect the mortality and other things? Since I think you are using share data, and for share data, they survey people not only after retirement, but also those in the labor market.
Yes, you're right. We haven't actually. It's true that we were envisioning this more as an older people issue, but it's true that we have data on the 50 plus. Many of them are actually working until 65 at least. And so we could totally have looked into that. It's true. It's I haven't seen lots of actually. Yeah, it's not something that has been investigated much, I believe. I wonder why. But yeah, are you thinking of like job loss, for example, or are you thinking of being socialized? Because we, of course, we do control for being retired or not, because we believe that you might be more socially isolated if you don't have a job, if you're not going every day to work, or you on the opposite, maybe you are more isolated because you don't have your hobbies and this kind of thing. So we do control, but we didn't do any interaction. We could have.
Thank you so much. Any other questions? Thank you, Dr. Fares.
Thank
yeah,
you
in the
so much.
interest of time, let's move to the second speaker, Dr. Ricardo Cisis, and who will be speaking on behalf of the co-authors on the topic about crime. The floor is yours. Could you share the screen? Let's see. Yeah, perhaps we will switch the order of the presentations since we're not finding the presenter. So could we switch the order with the third presenter, Dr. Augustine de Calon? Could you speak first about your paper about the health benefits of reducing aircraft pollution? The floor is yours.
Thank you, Xi. So thanks a lot, Klaus. I think it's a great way of trying to put out our papers, and thanks a lot to Alfonso, Flores-Lagunes as well, and Madeleine Zavoni. They've been both editor and managing editor. So yeah, hi Klaus. So let me share my screen. You see my slide?
Yes.
Yes. Okay, great.
Could you share the full screen?
Oh yeah. That's it.
Yes. Yeah, it works well. Thank you.
Yeah. So this is joint work with Sylvia El-Bialy, was doing at the time a PhD, but now she has she's Dr. El-Bialy, and Mary O'Mahony with we're both, the three of us, based at King's College in London. So this paper is looking at the impact of air and noise pollution, but you're going to see on health, and more specifically looking at the negative externality of aircraft or airports. So maybe I switch the sort of theory, sort of framework, but focusing on basically a negative. Everyone would agree, externality imposed on people living near airport. So there is previous work, including Schenker and Walker, looking at 12 major airports in California. What we do and what we are looking at in this paper is taking advantage of trial that was implemented in 2012 and 2013 for 5 months, and we're able to study changes over those 5 months in the numbers of medicine prescribed for three categories, three health conditions. So for nervous system disorders, for respiratory condition probably more explained by air pollution, nervous system probably more caused by noise pollution, cardiovascular, the literature is not so clear, but probably by both. So what we add as contribution is that we use actual medicine prescribed by doctors to their patients, rather than basically relying on self-reported health condition. Another contribution we think is the possibility of quantifying quite precisely the impact of pollution on health. And we think the case of Heathrow is a particularly interesting one, because it's a, maybe you know or you don't, it's in the top 5 most airport with the highest level of traffic landing and takeoff per year in the world. And but as well, it's an airport which is extremely located very close to the city center, much closer than many other airports in major cities, and therefore a lot of people living in London, even in central London, are affected by the traffic around Heathrow. So what we do is that maybe that's the most interesting aspect of the paper, is that we directly address the problem of avoidance behavior, because potentially people who live closer to airport get some funding to have double glazing or shut down the windows not to be disturbed. So what we do is that we use, and so basically develop avoidance behavior. So what we do is that we use this trial in very early morning, and the trial was for every redirecting planes between that lands at Heathrow between 4:30 in the morning until 6. So that's the time where most people are at home and trying to sleep. And therefore, it sort of addressed quite directly the problem of avoidance behavior, because effectively you are at home and much likely overflown by landing aircraft. So with approximately 16 arrival landing in this time point between 4:30 and 6. So that's 16, that's one every 4 or 5 minutes. So that's just when you have the first landing, it wakes you up, then you go back to sleep, and then 5 minutes later you have the second one, and it lasts 16 times, basically lasts for during the 1.5 up to 6. So I think that's a sort of interesting aspect of this trial. And the other interesting thing of this trial is that it was never implemented. So here you see sort of in red the flight path, and so maybe you can distinguish, but maybe not. You can see Westminster here. So you see this is really central London here, which is really overflown by a lot of those landing plane at the end of the night. And so I maybe don't spend too much time on the practicalities of the implementation of this trial, but effectively what it meant is that the plane were made to fly a bit further east in order to join the landing path, and therefore avoiding for people in those areas here being giving some relief. So the idea was to provide more people with relief, but overall there wasn't a less landing during the trial, exactly the same numbers of planes landed. So it was really trying to provide respite for the majority of the population, but of course at the cost of imposing more plane overflying other part of the city. But the idea was to affect less people negatively than you affect people positively. So again, the trial was not so easy to introduce and present in the paper because he was on alternative weeks, but I'm going to skip that part. Overall, we identify control areas, which are Heathrow here being to the west of the city. And those areas, those two rectangles here were the control area, because all the plane, as we've seen, turn over the city and then join a flight path and then land here that way. And then we identified GLE1 for Greater London East 1, GLE2, and GLE3, the three zones that were impacted. So we're going to see in a minute how. So it's a classic diff and diff, but with a pre and post. So we use the same month a year before, and we compare what happened in those three affected treated area, using as control the two, what happened in the control region over the same period. And we introduced, so we said the outcome was GP spending on those three conditions we mentioned earlier. And then we introduced all the covariates we could find. This is GP practice area-based data. So this is not individual-based data. We could use only prescription at the level of the medical doctors. Right, so that was a slide where we were looking a bit at pre-trend, so a bit more to say. But overall, what we find across the whole treated region, across the three regions, we find a reduction in the spending for nervous and respiratory, and an increase for cardiovascular, but not significant. And of course, what we were interested is to know whether this overall impact across the region that were positively and negatively affected, how it varied across the three treated areas, GLE1, GLE2, GLE3. And so we indeed found that the two areas that were given the greatest respite, so less plane landing, had quite a large reduction in the spending for nervous system, whereas the area further to the east, GLE3, was overflown more and therefore had an increase in those conditions, in prescription for those conditions. So we were asked by the referee to do an even study with excellent referee reports, and asked us to do quite a lot of robustness check as well. So we did like I think 14 robustness check, but the most interesting is I think the event study, where we were asked as well to include the new literature on two-way fixed effects, and we used this excellent program written by Gartner, Butts and Gartner on our software, that allows us to use the different method developed in the literature that account for potential heterogeneous effects. And that's where we find, so that's the monthly, the number I gave you before, where basically the unique diff and diff coefficient. Here we're looking at the different value across the 5 months of the trial compared to the year before. So for quite consistent results across the different method, but visually quite clear. That's the one we put on Twitter. We thought it was quite a nice way of showing the impact of those reduction in prescription, therefore positive effect of this trial. And then we did a bit of a back of the envelope cost benefit analysis, where we looked, we tried to measure the amounts saved So you probably all know the NHS in the UK. It's a very centralized health system, taxpayer-based health system. So we find the prescription saved only for nervous system were around 300,000. If you add the one for cardiovascular, you get to a total across the different GP practice around 5 million. And of course, this is a lower bound estimated and underestimate the real cost to society because we not accounting for the smaller number of visits, the reduced number of visits to the GP, and as well the basically increased productivity and reduced absenteeism that were allowed by this trial. Now, the sort of sad outcome, so that's a very positive story in a way. You introduce a trial and you improve health condition, reduce the noise early morning to more people, then you increase it to other people. But effectively, it's as well a bit of a sad story because the trial was never implemented. And the reason why is because it's a typical case of the minority suffering alerted some member of parliament, and that made headlines in the newspaper that they were badly affected. So the minority sort of managed to prevent the trial being implemented. Of course, the majority who benefited were not as vocal than the badly affected ones. So that's a bit of a story of typical difficulties of implementation of sort of a policy that affects the majority of people in a positive way, but affect a minority of people in a negative way. So yes, so I think that's more or less reached my 10 minutes.
Thank you so much for the wonderful presentation. And is there any questions from the audiences? Yeah, I enjoyed reading this paper. I have a question actually about why early hours matters more than the other hours. And is that a combination of noise and pollution? So could we like further distinguish these two?
Well, I think I've spent quite a lot of time reading the epidemiology literature, trying to find out why is so tricky those hours between 4:30 and 6. Apparently, your rhythm during the night vary quite a lot, and you have a less deep period of less deep sleep in early morning than you have early on in the night, and therefore the same level of noise will be affecting your sleep more if it's early morning rather than late evening. And that's probably the reason why they tried to introduce this trial, because probably Heathrow had quite a lot of complaint from people saying, yeah, I couldn't sleep this morning because, yeah, I was overflowed. And now your second point was, is that really the noise or the pollution? Yeah, we had this discussion with referees as well and colleagues. We're taking a sort of agnostic view on that. I'm quite happy to say that there is an impact of pollution as well. But we find a bit less significant impact on cardiovascular, and generally a lot of epidemiological study found that air pollution affect cardiovascular more than other conditions, because we were finding quite a lot of impact on nervous system, which is effectively insomnia and mental health. We sort of think most of the effect here we could observe was from noise, but we don't exclude at all that air pollution may have affected as well.
Thank you so much. Any other questions? Oh, someone. Yeah, please. You can.
Yeah, thank you. Thank you, Mr. Chair. My question is more on the previous presentation. Can I go ahead? Can you hear me?
Yeah, there was a delay in the. Could you speak again?
Okay, my question is more on the previous presentation.
Oh, sure.
Can I go ahead?
Please. Yeah, I think Dr.
Okay.
Flores is here. Yeah.
Okay, thank you very much. No, I was just wondering whether the authors conducted some analysis around the intensity of social exclusion, because the way they are doing it right now is that they consider 3 dimensions, and then any of the dimension will warrant the explanatory variable to take a value 1. So it's considered as a dummy variable. So my point here is, how can they consider someone like combining the 3 dimensions of social exclusion together or social isolation together relatively to someone having only 1 dimension of social isolation? The second aspect of it is related to exposure to social isolation. Do they observe heterogeneity with respect to the duration of the social isolation? So I think those are 2 aspects around which the analysis could enrich upon. Thank you very much.
Thank you for the question. Hi, Dr. Flores. Are you here? Yeah, since I dropped her a message, but didn't hear from her. Yeah, I think one way is to just type in the question and send to her directly.
All right, thank you. I will do so.
Yeah, please send. We still have time for this session, so you can send the message to Dr. Flores directly, and I will make sure the message will be delivered, and we can also send her email if she is away. Okay, since we don't have heard from the second speaker, now let's move to the next speaker, Dr. Aludai Jaimai. The floor is yours. Thank you.
Thank you.
Yeah, looks good. You can start.
Oh, okay. And here.
Oh, you may also share the full screen.
Okay, good. Okay, so good morning or good afternoon, everyone. I'm very pleased to have the paper published at the Journal of Population Economics and to have the opportunity to present our piece of research. This is a joint work with Johan Renard and Anne-Laure Sanson. This paper builds on a large existing literature on the relationship between health and education. From this literature, we know that parental education tends to improve child health, and previous research has mostly focused on the role of mothers. Secondly, there is an endogeneity issue in estimating the effect of parental education on child health due to omitted variable bias. And one way to estimate causal effect of parental education is using exogenous exposure to education reform in instrumental variable strategy or regression discontinuity design, using as exogenous variation the exposure to education reform, such that an increase in the supply of schools or a rise of the school living age or changes in school fees, for example. Our main contribution in this paper is twofold. First, we include father's education in the model, and we discuss whether, due to marital assortative matching, the previous findings capture the effect of mother's education per se, or capture the effect of father's education, if not controlled in the equation. And secondly, we discuss possible sample selection bias, because by definition, in most household survey data, the researcher is able to observe both child outcomes and parents' education, if and only if both live together. And we wonder whether previous findings that rely on the sample of children living with their parents, either the mother, the father, or both, whether this sample is selected. In this paper, we use 4 waves of demographic and health surveys that are nationally representative household surveys. We use the data from Zimbabwe in Southern Africa, and we use 4 rounds of data that are the rounds collected in 1994, 1999, 2005, and 2010. If we pull all these 4 waves of data together, what we obtain is that about half of the children aged less than 5 years old are living with both parents. So the issue of possible selection, sample selection bias seems to be relevant. And also in this data, we have parents who were exposed to an education reform which took place in 1980, and some parents are not exposed to this reform, and this provides our exogenous variation in the secondary education attainment. In the paper, we estimate a simultaneous equation model where we will have 5 equations in order to take into account not only the endogeneity bias of education, but also possible selection into co-residence between parents and children. In the paper, child health is measured by 3 sets of outcome variables: prenatal care and birth conditions, which are retrospective. And we have also contemporaneous measures, namely malnutrition status, and also information about prevention through questions about immunization and the use of bed nets. So as I said, we use a 5-equation model to take into account both the possible selection into co-residence and also endogeneity bias. So here I summarize the 5 equations. So we have first 2 equations for the probability to live, for the child to live with his mother, and same the 1 equation for the probability that the child and the father are living together at the time of the survey. So they are household members of the same household. And these 2 equations are estimated over the whole sample, the entire sample. And from these 2 equations, when we estimate them, we are able to compute the inverse means ratio. And next, we have the second set of equations that are related to education. So here we estimate mother's education using mother's exposure to the education reform as an instrumental variable. And same for the father, we have 1 equation for his level of education. It's either years of education or the fact that he attended secondary school. And again, we use the father's exposure to the reform that took place in 1980 as an instrumental variable. And lastly, we have the outcome equation where we estimate child health outcomes as a function of each parent's level of education and also as a function of the meals ratio. So just to come back, here on this equation 3, we need to have the child and the mother living together to have the level of education of the mother. And for equation 4, similarly, we need to have the father living with the child to have the information. So at the end, the last equation, the outcome equation, will be on the restricted sample of children living with both parents, because we observe as a determinant in this equation the level of education of both parents, and also we control for both inverse meals ratio that we obtain from the estimation of equation 1 and 2. I'm sorry, I didn't prepare the slides to have the tables, so here it's just a summary. I thought as the time was constrained, it was better like this, and for sure the numbers are in the paper, if you are interested in the size of the effects. So here I summarize 4 sets of results. So considering that the first 2 are the most important. First of all, we found that father's education affects the health outcomes of their under 5 children, and the father's education matters more than the mother's education in our sample in Zimbabwe. We found that father's secondary school attendance improves prenatal care, birth conditions, and increases the number of vaccine injections the child received, even though it has no significant effect on nutrition outcomes. Regarding mother's education, whether we take years of education or secondary school attendance as a measure of mother's education, we found no effect, no causal effect of mother's education on any outcome when father's education is included in the model. Mother's level of education matters if the father's education is not controlled for. The second set of results concern the possible selection into co-residence. What we found is that the inverse meals ratio are significant in explaining child health, but on the other hand, it's including the meals ratio, so controlling for the meals ratio or trying to correct for the selection into co-residence do not affect the coefficients of parental education on child health. The size of the coefficients are unchanged and the significance level are unchanged. In our sample, we or in the paper, we also show that assortative matching is important in Zimbabwe, whether we look at the correlation of the observed level of education or the correlation between the unobserved elements. So first, for the correlation between fathers and mothers' years of education, the correlation is about 0.6, and the correlation between the residuals of the first stage equation is around 0.4 or 0.6, depending on the measure of education we use. Lastly, our results suggest that not taking into account the education level of both parents may yield to misleading conclusions, because the causal effect of mother's education is significant, in our case, only if father's education is not controlled for in the model. Okay, so here I can stop here with the summary of the main results. Thank you.
Thank you so much, Dr. Jamai. And that's an excellent presentation. Any questions from the audiences? We have a couple of minutes for discussion. And also for Dr. D. Kalon. Welcome to join. And any questions to any of the 3 presentations?
I have a question to Elodie.
Please.
Yes, Augustin.
Do you have any evidence of effect differentiated by gender of the children? boys versus girls?
I don't remember what was in this. This is a question mark. We did it, but I don't remember if we keep it in the last version, and I don't think so.
You generally go
Yeah,
to very small sample
I can't
size.
tell. Yeah, we look at it, but yeah, if I remember correctly, there were not strong differences between both, because we have this idea of maybe mothers influencing the daughter and fathers the son. I'm very sorry. Yeah, very good point, but I can't remember. But I think that yeah, if I remember, I'm not entirely sure about the result we obtain.
Okay, we have a second question from the audience. Please, Sehawa, you can unmute.
Thank you very much, and thank you, Elodie, for excellent presentation. No, I was just wondering whether the authors conducted kind of external validity of their findings, because I guess Zimbabwe is not the only country that has implemented search reform, and where we can find different exposure to education and like secondary education. So did you try to like check if these findings are the same or remain valid in different contexts, so that you can have like you can broaden the scope of your findings?
Yeah, thank you, Alidou. It's a very good point. We didn't try, but I know that there are other papers who are using similar reform, so the universal primary education type of reform. There is one paper in Nigeria, not necessarily on the to estimate at the end of the day the effect of parental education on child health, but other papers were interested in labor market labor market outcomes, for example, and they use the exposure to education reforms to estimate as an instrumental variable for the education attainment. But yeah, we didn't try. We didn't try. At least, I guess the main, what I would be interested to check is this idea of selection into co-residence, because it's less documented.
Thank you. Any other questions? Yeah, I actually have one question for Dr. Jaimai and also Dr. DeCallum. Another question, Dr. Jaimai. So you mentioned about you talked about assortative matching. So that's important. So how to tease out the impact of the education from fathers and mothers? I know you are using some exogenous variation to look at, so that education reform may affect one parent but not the other, right? So is that the way to distinguish the joint effect?
Yes, exactly. And so I show the numbers for the correlation between parents' education in terms of observed levels. And when we computed the correlation coefficient for the predicted education level, the correlation was much lower. So we have, the difference between the two that are coming from the different level of exposure, also, and mainly in our case. So to come back maybe on Alidou's point, we can do it in Zimbabwe because the difference in age of the partner is quite large. So I guess that this setting is less relevant for countries in which both partners have the same age.
Okay, thank you. And another just random thought.
Sorry, may I come in?
Yeah, sure, please.
That's very interesting. If the difference in age of the partners is quite large, meaning that the husband may have a final say on the household decision-making process compared to the wife, that might be the actual mechanism through which decision regarding children health or education are made. So at the end of the day, maybe the story is not really about the education of the husband, but it is also about the combination of the education and also the role of the different spouses in the decision-making process of the household. That's something interesting to dig in.
May I reply to this, or
please.
We don't have time? Okay.
Please.
Okay, thank you. In the demographic LS and L surveys, so the data we are using in the most recent wave, but not for 1994 as the first wave we use in this data. But for more recent waves, we have information about decision making in the households. So this is something we can use for later work, for us or anyone. But the point is that then for the most recent wave, we don't have people not exposed to the reform because as we delay and we will have adults for which all have been exposed. So, okay, so this is something maybe we will be limited in what we can do due to data limitation.
Yeah, thank you so much. And
thank you.
Yeah, my question to Dr. DeCalon is you investigate about the impact on the prescribed medications. So is there any existing study in the literature about UK about pollution and over-the-counter medications, those not prescribed, which can also be covered by insurance or sometimes out-of-pocket? Because when we think about the pollution effect, we may think about the overall impact on the pharmacy purchase. And and sometimes people may take avoidance behavior, think about if on polluted days, and people may avoid going to see the doctor. So they may purchase online if that's possible.
Yes. I'm not aware. A lot of people in the UK are using prescription by the doctor to be able to save on cost of buying the medication, because for most people it's free when you have a medication which is prescribed. For people above a certain income threshold, you pay 10%. But data in terms of actual spending for over-the-counter, that's a good point. No, I'm not aware of any. Yeah, you need to work on pharmacies.
Yeah, that's challenging. Data, administrative data may not be available, and
Yeah.
Thank you
I'm not
so
aware
much.
of any.
Yeah, please. In the last session, just the session before our session, there was a paper about mortality, mobility effect of air pollution in China. So the authors look at the medications as a result of air pollution, because that's also covered by the insurance, the local insurance. And people sometimes going to see the doctor just trying to prescribe medications, but it's for like common flu and other common illness. They just purchase online or go to the nearest pharmacy. So they have such data, but only for one city.
Excellent. Sounds very, very promising. Yeah.
Yeah.
Thank you.
Yeah, thank you so much for very high quality presentations and discussions. And Klaus, do you have something to say before the end of the session?
Well, so yes, welcome back. And well, I hand over to Alfonso Flores-Lagunes, another editor of the Journal of Population Economics.
Very good. Well, thank you very much. Very happy to be here. And in this session on education, we have two papers. And just as a reminder, we have 15 minutes per paper, give or take, about 10 minutes for the authors, and then the rest discussion from the attendees. So the first paper is by Kendall Kennedy, and I will let you go on and give us your title and everything.
All right, so let me share my screen really quick. There we go. All right, can everyone see this okay? Perfect. So thanks for having me. I'm going to present Hidden Schooling, Endogenous Measurement Error and Bias in Education and Labor Market Experience. This is a paper that I've been working on for a very long time. Back in the day, this was my job market paper. And so I'm very excited that it found a great home at the Journal of Population Econ. So this paper is largely about how grade retention influences the way that we estimate things in education. So first off, we need to know a little bit about what grade retention looks like. Grade retention, I mean, repeating the same grade, the same set of coursework in your education, in your regular schooling. So this is a picture of what grade retention in early secondary school in the US looks like. What you can see here are three lines. The top solid blue line is the percent change in enrollment from the 8th grade to the 9th grade in the US by year. So you can see it starts off in the late 1960s, early 70s, a little bit under 5%, but then through the 80s until the early 2000s, this rises all the way up to almost 15%. Where 9th grade is larger than 8th grade, despite it being in the next academic year, despite the fact that these should be roughly the same size. You can see an almost mirrored pattern with the change in enrollment from 9th grade to 10th grade, where 10th grade is about 3% smaller than 9th grade, and that rises to about 12% smaller in the late 90s, early 2000s. 8th grade to 10th grade, though, that enrollment change is flat over time and hovering around 0. So really something weird is going on here in the 9th grade, and that weird thing is a really marked rise in grade retention happening in the 9th grade in the US over this time period. So overall, grade retention rates more than quadrupled in the 9th grade from the 60s to the 90s. What I'm kind of taking away from this, based on these data and on some other data that I use in the paper, 5 to 10% of American students will repeat the 9th grade specifically. Overall, 20 to 30% of American students will repeat some grade at some point in their academic career. And this is pretty widely overlooked in the education literature, and overlooking it can create some problems, which is the main focus of my paper. So what am I going to do in this paper? I show how unobserved grade retention affects estimation, broadly speaking. And the issue here is that grade retention causes a gap between educational attainment and years of schooling. We typically think of these pretty interchangeably, but grade retention makes these different from each other. Educational attainment's the highest level of schooling you've completed. Years of schooling is how many years you're in formal schooling. If you repeat a grade, then obviously years of schooling increases by 1. Educational attainment doesn't change at all. So first off, I'm going to show that compulsory schooling laws increase your years of schooling, but not necessarily your educational attainment. And the split here is actually pretty even between increasing educational attainment and increasing grade retention in early secondary schooling. So if we use the very conventional compulsory schooling IVs to do 2SLS estimation to estimate the effect of education on wages, we're going to find 8 to 38% positive bias in the wage return to education if we just ignore grade retention altogether. This also creates a problem if we're looking at typical measures of labor market experience. So going all the way back to Mincer 1958, we have this potential experience proxy that we use. age minus education minus 6. This is problematic because education is educational attainment. So we have problems with comparisons between countries. Different countries have very, very different retention rates. And we have problems when we are controlling for education and experience and trying to estimate something else. So those are the big contributions of the paper. I'm going to go through the details a little bit faster from here. So first off, compulsory schooling instruments are endogenous with 9th grade repeating. So I can look at the effect of the minimum dropout age on the different grade retention measures that I showed a couple slides ago, the 9th to 10th grade enrollment change and the 8th to 9th grade enrollment change. What you can see is that the 1-year increase in the minimum dropout age is increasing grade retention by about 0.75%, 0.75 percentage points rather, which is pretty substantial. That's roughly in line with the effect on educational attainment. So if we look at what the IV estimate of the returns to education would be, it converges in probability to the actual effect of the effect of education on wages, plus this error term. This error term is a ratio of the effect of compulsory schooling on repeating divided by the effect of compulsory schooling on attainment multiplied by the actual return to grade retention. So assuming that all of these things are positive, this is going to create positive bias in our IV estimate. And that's exactly what I showed. So if we look at quarter of birth instruments, comparing our 2SL estimate without accounting for retention versus with accounting for retention, got about 36% positive bias if we ignore 9th grade repeating. And then in terms of instrument strength, quarter of birth is a strong instrument. It's a weak instrument for 9th grade repeating specifically, but it's strong for educational attainment. And so the estimated effect of educational attainment on wages is going to not suffer from weak instrument bias. If we look at quarter of birth and compulsory schooling instruments together in a group, we see a very similar pattern. We see 23% positive bias if we ignore 9th grade repeating, and a very similar pattern of instrument strength. So now let's move on to talking about labor market experience. Lots of regressions are going to depend on estimating the returns to education and or the returns to labor market experience, even if they're interested in some other object. So there are some issues here. If grade retention is correlated with the variable that we're actually interested in, controlling for education and experience while ignoring grade retention can create pretty substantial bias. So why am I talking about experience? We typically have this Manserian proxy, age minus education minus 6. We're trying to capture potential experience, the number of years that you've been in the labor market after leaving school. But if you repeated a grade, then you have fewer years in the labor market than we are proxying for. So if we have 10% of people in the US repeating the 9th grade and almost 30% of people repeating any grade, this potential experience proxy is going to overstate the actual labor market experience of a pretty large portion of our population. So this can create some problems. First off, let's think about the returns to experience across country. The US is actually fairly typical worldwide in its grade retention rate. All right, can everyone see this okay? My Zoom crashed for a second. We good?
Yes,
all right.
It's okay.
All right, good. So the US is pretty typical. If we look at grade retention before age 15, which is what the PISA measures, the US's average is about 11%. OECD-wide, it's 11.3%. So the US isn't an outlier in grade retention by any means. If we look at Latin America specifically, they'll commonly have grade retention rates pushing 50%, very, very high. The highest in this data set is actually Algeria. Their grade retention rate is almost 69%. Just a huge portion of their country repeats grades at some point. So if we look specifically within Europe, we also see a lot of variation. Southern and Western Europe tend to have very high retention rates. Spain, Portugal, Belgium, and Luxembourg all-life retention rates over 30% before age 15. Northern and Eastern Europe have very low retention rates. Norway has automatic promotions, so virtually zero, and rates are typically in the low single digits for the rest of Northern and Eastern Europe. So this can create problems if we're trying to compare experience wage profiles across countries. So this paper in the Journal of Political Economy in 2018 did exactly this. They compared the steepness of experience wage profiles across countries using this potential experience measure. But the issue that I found is that countries with steeper experience wage profiles in their income group have low retention rates. And so a lot of what's going on in comparing the steepness of experience wage profiles is driven by grade retention differences between countries. So unfortunately, I can't directly replicate this because data availability is just poor for linking grade retention to labor market outcomes, but I can replicate what they've done for the US. And I show basically this graph, that if we do a basic control for labor market experience, we have a flatter experience wage profile. If we correct it for grade retention, then we have a steeper experience wage profile. And so we need to really think about this if we're making comparisons across countries. Now, let's also think about how controlling for labor market experience can introduce problems into our estimation. So first off, let's think about the black-white wage gap. Black students are about 2.5 times as likely as white students to repeat grades. The black retention rate is about 35%, and the white retention rate is about 12%. And so if we take this to estimating the black-white wage gap in adulthood, we can see that that not accounting for repeated grades and differences in grade retention between black and white students causes about 10% bias away from zero in the residual black-white wage gap. If we look at something like the returns to the GED, the signaling value of the GED, GED recipients are pretty similar to high school dropouts in their grade retention rates, 3.5 times as likely to repeat compared to high school graduates. And so again, if we correct for grade retention in our measures of labor market experience, the wage return to the GED is biased by about 14% away from zero again, if we don't account for repeating grades. The labor supply gap between a GED recipient and a high school graduate is about 33% biased if we don't account for repeating grades. So at the end of the day, what do I suggest researchers should do here? A couple of suggestions here. First off, compulsory schooling instruments are just endogenous with grade retention. So if you can't observe grade retention or you don't want to observe grade retention, you shouldn't use these instruments. They are not valid instruments if you don't account for their effects on grade retention. Second, researchers need to understand whether their data come from a high or a low grade retention environment, especially if they're going to be estimating things like the returns to education or returns to experience. And then finally, if you want to control for labor market experience, just controlling for age is a safer control variable. Age is unaffected by grade retention, and as a result, it's going to proxy for potential experience without introducing that kind of endogenous measurement error that creates all of those problems with black-white wage gaps and things like that. So that is all I have, and I'm happy to hear any questions and comments. Thank you.
Excellent. Thank you very much. So I guess this is a small enough group. If you have questions, you can just unmute yourself and ask.
Kendall, why do you think the grade retention is happening? Why the big increase?
Yeah, so there are a few different reasons. In early elementary school, grade retention tends to happen for behavioral and social reasons, where kids are just immature for their age, and so they'll repeat a grade to help them develop social skills, make friends, things like that. Once we get to the 9th grade, grade retention almost entirely seems to be centered around passing Algebra 1. So if kids fail Algebra 1, then they repeat the 9th grade. And you can see in a lot of these different data sets that they will fail Algebra 1, 2, 3, 4 times consecutively. And that holds them back in the 9th grade and prevents them from being on track to graduation.
But how come the trend? Why is it increasing? Is algebra getting more difficult?
That is a good question. I think that from doing some background reading on what happened in this time period, I think that before the 1980s, there was just a very common trend of social promotion in the US, where they would promote kids to the next grade even if they failed Algebra 1, and even if they weren't making friends in early elementary school. Where once we hit the 1980s, some of the big reforms that Ronald Reagan's administration put into the US education system were that kids had to meet certain academic standards. That's when we saw the rise of the testing movement and the accountability movements. And so they started retaining kids who couldn't meet some set academic standards. And then once we hit the late 90s, we see that decline because people realized 9th grade retention was so bad, and put in some effort at making kids pass Algebra 1 more easily, but also increase social promotion again, back closer to what it used to be.
Well, the issue I have is grade retention good or bad? It could be both, yes? I mean, for some people, that is helpful because they couldn't make it in one environment, and in the other one, they do much better. So in other cases, it might be just a signal, these are not good people, or whatever. What is your opinion?
Yeah, so there's some really interesting research coming out right now about the short and long-term effects of grade retention. Typically, what you tend to see is in the short term, grade retention is beneficial for students, that it boosts their math and reading scores, that it helps them make friends, things like that, especially in early elementary school. Some of the interesting work coming out now, though, is on the very, very long-term effects of grade retention. That are honestly built on the kind of ideas that I'm talking about in this paper, where grade retention reduces the number of years that you have in the labor market. And so any labor market effects of having increased human capital coming from grade retention in the 3rd grade, for example, have to be enough to counteract the effect of 1 year less in the labor market. So what most of the research right now is finding is that there are mildly negative effects on the longer term labor market outcomes for these people. And it's entirely driven by the fact that they just don't have as many years of labor market experience relative to someone else in their age cohort.
Okay, interesting. Now, a different issue I had is with what are the implications for, I think, taking attention into account changes the evaluation of experience in wage earnings, whatever functions. Yes. Now this is certainly true for men. Easily there is a problem, but for females, well, there are many other problems measuring experiences by the formula you presented, the traditional one.
Right, of course.
It's completely misleading anyway. So the relative importance must be more for males than for females.
It definitely is once you get to, say, mid-career or so. Early career, especially in the modern generations, men and women have fairly similar labor force participation. And so in the early career, this experience control is reasonably good for both men and women. And retention is not, there really isn't a retention gap between men and women, at least not in the US, where I can see this breakdown. But you're completely correct that once we hit mid-career, once women start having children and dropping out of the labor force, it tends to be what happens. This problem does diverge for men and women, for sure.
Thanks.
Very good. So I suggest we move on. You might notice that we are a little bit behind schedule in terms of the original program, but we have a buffer, so we're doing good on time. So let's move to the next paper. Thank you very much, Kendall. The next paper is by Rushita.
Rusika, you're muted.
You are muted.
I noticed. Sorry. Can everybody see my screen? Okay,
Yes.
good. So first, I would like to thank the organizers for providing us with the opportunity to present our work. And our work is basically motivated by the fact that, as you can see from this image, military service, be it compulsory or voluntary, is pretty much present throughout the world. So it was only natural to ask ourselves, what are the effects of serving in the military on persons' outcomes, and us being labor economists, on labor outcomes, or in the case of this paper, on educational outcomes. So in the literature, you will find quite divergent results. For instance, in Swedish and Dutch data, they find negative outcomes. In Turkish and French, they find positive, no statistically significant impact in German and British data, and quite differential effects in Danish and Portuguese data. And the reason is, if you remember from the previous image, is the high heterogeneity of military service regimes, but also the fact that, you know, as I said, first of all, because different authors use data from different countries with different military regimes, and also they use different identification strategies to overcome these three usual issues that come up in this kind of setup. And by the very nature of Cypriot data, which we use, we're able to overcome the first two issues, because in Cyprus, military service is compulsory for every male citizen who turns 18 in the year of conscription. And to overcome the immediate variables bias, we make use of two reforms which work in opposite direction. The first reform effectively increased the average duration of military service by introducing some new forms of service for people who would otherwise be exempt, like serving in unarmed capacity for conscientious objectors. And the second reform reduced the number of the duration of military service from 2 years to 14 months. At the public universities, the students who decide to pursue university education do not pay any fees, but they do have to take a very comprehensive exam, which is completely centralized, and it's called Pankyprias, which means that everybody who wants to enter the university in Cyprus takes the exam on the same day. And as you can see from these statistics from 2019, slightly more students go to study abroad, mostly to Greece. Then they stay in Cyprus, so 2,800 stayed in Cyprus to study. We were lucky enough to be granted data from the University of Cyprus, which contain personal information, academic records, and for the purpose of our analysis, the number of academic semesters spent in the military service. To level the playing field, we only kept Greek Cypriot students in our data set who attended a public secondary school. They were between 17 and 21 years of age on admission, and they were studying for their first degree at the undergrad level. And that left us with about 12,000 students that we observed from 2008 to 2019. This is our variable of interest, grade point average. And we use two different approaches in this analysis. The first one is selection of observables, where we introduce stepwise controls to the basic model. And then the second approach is difference in difference analysis, making use of those two reforms that I mentioned previously, where we compare male students to their female counterparts. So female students we use as a control group. So this is the first approach, selection on observables. In the basic model, we have male dummy. We have the turn count, which is the variable that measures the number of academic semesters spent in the military service. And we also control for trend. Then we do stepwise robustness check by adding a proxy for ability, a proxy for maturity, and cohort effects, and finally area dummies. So these are the results, and you can see that there is very strong correlation between the grade point average and the number of academic semesters spent in the army. And we also find in this quantile regression, we find differential effects similarly to the effects found in the literature with Portuguese data, where the correlation between the grade point average and the number of terms, academic terms spent in the army is stronger for students at the lower end of the grade point average distribution. The second approach, as I mentioned, is difference in difference, where we use female students as a control group to make sure that no anticipation hypothesis stands. We use 2-year event windows, and to test for parallel trend hypothesis, we use 2 placebo reforms. These are the results. Again, you will see that the first reform, which effectively increased the number of school terms spent in the duration of the military service, worked to increase the grade point average, whereas the second reform, which worked in the opposite direction, decreased the grade point average. And maybe this is even more visible from this graph. The red line are male students, and you can see the jump after the first reform and a drop after the second reform. And I especially put up this slide to show you that in between the 2 reforms, you can see that the parallel trend hypothesis stands. So in order to try to explain the results, we conducted a small survey asking students to assess whether over the course of the military service, their skills deteriorated or improved. And you can see that by on this graph, you can see that what we may call hard academic skills significantly deteriorated, especially algebra and this thing, the geometry and trigonometry. Whereas at the same time, something that we can refer to as the soft academic skills. Also in psychology, they are known as executive functioning skills. They were improved over the course of the military service. So I guess that though the hard academic skills depreciated, the soft academic skills seem to have improved. So apparently there are some benefits from the serving in the army, and especially in since these soft skills seem to be at least as equally important in an academic setup. So I'm open for questions.
Excellent. Thank you very much. Again, anybody who has questions can just go ahead.
I skipped through the methodology. So if you have any questions, you can, now is your time, because I just wanted to make sure that I'm on time, that I hit the 10-minute mark. So I may have spent less time, but then I think that this leaves us enough space for a discussion.
Very good. You know, something that came to my mind is whether the military recruits for sort of permanent positions out of the people who are conscripted, and whether that potentially change with the reforms.
Can you please repeat that question?
Yes, so what I have in mind is that the military needs to also fulfill permanent positions. And I am just wondering the extent to which in Cyprus, the military might recruit from the individuals who are conscripted, and whether that may have changed with the reform.
Yes, I'm not sure to which extent reform related to this, but usually what happens is that people who go to serve in the army, they can apply for a rank, and then this is how they become, then they can advance in the army. So they do start, as I said, it's compulsory for every male citizen who turns 18 in the year of conscription, and this is how they start. They, at the very beginning, they can apply for a rank, so that they are not like just regular soldiers. But I'm not sure to which extent this reform affected them. But it could be an interesting idea for further research.
Sure. Yeah, thank you.
Just a question, Rudzika. Two questions,
Yes.
actually. The first one, do you, for measuring performance in trigonometry, math, and the sort of non-cognitive skills, do you have a before and after? That was my first question. My second one, when I serve in the army, just for 4 or 5 months, I work in Switzerland, it's compulsory. So I work in the Howitzer, and I was actually asked to do some quite technical calculation on trajectories. So I was surprised. Actually, my trigonometric skills, they did improve following my experience in the army. So yeah, I'm interested in, could it be related to the particular of the army in Cyprus, where you, I don't know, maybe you don't have those very highly technical positions.
So would you consider yourself an average soldier?
We were all. It was compulsory. I don't know.
Compulsory, but would you consider yourself an average? Because here we're talking about averages. So
Sure.
would you consider yourself an average? Like,
probably not.
Yeah. Okay, so so the first question was how we came up with that diagram, right? Let's see, this one. So we actually, the questionnaire was for them to assess whether these different skills that we listed deteriorated or improved, or there was no change, or they don't know. And also to make sure that people who maybe didn't participate in the army would not, how should I put it? We also provided a question for the people who may have not participated, and we asked them if they know of somebody who went to the army, how would they assess the change in their skills. But basically, it was like this. So whether there was any change and whether the change was negative or positive. And also we had another question. We wanted them to assess to what extent these skills were important for them at the university level. And I could say that, I mean, there was some bias because we only conducted this survey in specific schools, and in schools where they have more social studies. So most of them said that they had no use of algebra or geometry, whereas all of them said that these soft academic skills were really important for them. I don't know whether I answered your question, but
no, Julie, thank you.
I thought that I really skipped through this diagram, and I thought the results were really important. It's interesting. Any other questions?
Any other questions? I may have another one. I mean, and this is all very interesting. I particularly like this real sharp difference between sort of substantive knowledge and the soft skills. That is really impressive, I think. But anyhow, my question is that you're focusing primarily on GPA, and I wonder, I mean, your data also sounds very interesting. I wonder if you have other outcomes, like, for example, graduation rates, and ultimately starting salaries or something like that. It can also inform a little bit of the consequences of conscription.
Okay, so let's back to the data that we have. This is the data that we've got. Okay, so I don't know whether you can see the whole thing, but we do not follow students once they graduate. However, we do have, as I said, we have these academic records. So we do have a list of all exams they have taken, the number of times they have taken exams, and the grades they received in each exam. And you were talking about graduation rates. So in terms of starting salary, we don't have access to any such data. But in terms of graduation, I think that there may be some something there. I'm not sure whether they graduated or not. I will have to look in the data.
Yeah. Potentially future projects. Yep.
Yes.
Excellent.
Yes. It's really interesting. Yes.
All right. Any other questions? Very good. So I think we should thank our speakers. Thank you very much. Great session. And what I believe is that we have a few minutes break and we can reconvene at 7 p.m. European time, Central European time. Anything else to add, Klaus?
No, nothing. Thank you very much. See you later, perhaps. Okay.
Okay, welcome everybody. This is a session on migration and refugee issues. And we have 4 papers. Right now we have 3 authors, so hopefully the last author is going to be with us soon. And as you know, we have 10 minutes for authors and then 5 minutes for discussion. So let's just get started. And the first paper is by Juan Chen.
Hi. Thank you very much for having me to sharing our paper. Let me share my screen first. Okay. So can you see my screen? See my PPT?
Yes.
Okay. 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 I want to share my paper on migration control policy and parent-child separation among migrant families, and this is an evidence from China, and this is the joint work with my co-author Voigt, who's also in this meeting. So because we are estimating an impact of the migration control policy in China, so before I started, I would like to use a few minutes to introduce the policy background. So for the background, we all know that China has the largest internal migration, and currently we have more than 20% of the migrant population to the total population. And among these migrations, there are more than 138 million children who are from the migrant family, who accounting for more than 40% of the children in China. And among these children, we know that almost half of these children are left behind from their migrating parents. And for all the parent-child separation, 92% of these separations are due to migration. And so the other fact of Chinese migration is that there's a siphon effect of mega cities. Migration now has shifted from rural to urban to small city to large city migration, which means that now in mega cities like Beijing, Shanghai, Guangzhou, and Shenzhen, accounting for over 40% of their populations, over 40% of their populations are migrants. And so the large migration in these mega cities actually has caused high housing price, traffic congestion, and environmental pollution. So for this background, in 2014, China has this national new type urbanization planning, which requires the large city with population of over 5 million at the city districts to control their city population. And so large cities start to set population targets in 2020, and the population control policy is more stringent for cities with higher population control pressure. So here is the table where it shows that the population, the third column is the population goal in 2020 for these 11 mega cities. And the last column is the population, their population in 2013. And we construct a policy pressure index. Which measures the intensity of the population control pressure of these cities. So to control these population, the mega cities use a lot of initiatives, which includes for shutting down free markets and closing small shops in the city. And one of the most criticized initiative is increasing enrollment requirements for migrant children to access for public education in the city. And all these policies are actually skill bias, which means that lower skilled migrant families are less likely to satisfy, and especially to satisfy for the school enrollment requirements. So we also construct an index to measure the specific school enrollment requirements. And so here we can see that from 2011 to 2013, which is before the policy, actually there's not that much changes in the enrollment of the school requirement. But after the policy, after 2014, we can observe that the school enrollment requirement for migrant children has been increased, especially for those school requirement enrollment for compulsory education stage. And actually, beyond compulsory education stage, because even before the policy, there's not that much supply for public education for migrant children beyond compulsory education. So the enrollment requirement does not change that much for the education stage beyond the compulsory education. So the main question is that we want to examine what's the impact of this migration control policy in mega cities after 2014 in China on parent and child separation. what we do is that we firstly developed a conceptual model which measures how the increases of the school enrollment requirement can affect the family settlement of the migration family. And also we empirically test this policy's impact by constructing two indexes for the 11 MEC cities. The first index is the city-level policy implementation measure, and the second index is the school enrollment restrictions on migrant children across cities and over time. And here the right figures shows that the policy control pressure index are highly correlated with the standardized education barrier score, which means that the higher the population control pressure then in the city, then the city will increases their education barrier more. So for our theoretical model, we actually includes the consideration of a family's settlement, and which means the family's migration settlement actually depends on their parental characteristics. It also depends on the relative quality of schools in the urban and the rural, and also depends on the relative wages in urban and the rural sector, and also the school enrollment cost. So by considering all these elements together, and we can develop a theoretical model, we developed a proposition which shows that the higher the school enrollment cost, then the higher the probability of children being left behind. And the risk is more pronounced among families with low SES. And the third proposition shows that whether the population control policy is effective depends on the relative urban and rural wage. So our main empirical findings is that we do show that the policy contributes to an increased probability of children being left behind. And this result is consistent by using either the policy control pressure index or using the school enrollment barrier scores. And we also show the heterogeneity results, which means that the impact is more pronounced among children from families of low SES, and also it's more pronounced for children at the compulsory education stage, which is consistent with the policy's feature, because the policy is skill bias and the policy change are most pronounced at the compulsory education stage. And we also found that the impact are more pronounced among girls. So our findings, we did a lot of typical robustness checks. And one of the robustness checks I want to mention is that we also use a lot of efforts to test for the composition of the migrant families in the city. And I think we are actually among a very few research that seriously consider the bias that could rise from the changes in composition of the migrant family. And so we test this by a lot of from different multiple angles. So we first account for ex-ante migrant selection, and we also test for compositional changes that could changes in migration population that could be induced by the family. We also use the prediction based on observed characteristics. And what we found is that the policy actually do not significantly change the composition of the migrant family, because we don't find that significant changes in compositional in their educational level composition or in their family structure. In more details, we don't find that it reduces the population of reduces the families with like more children or more low-skilled families with more children. So which means that the policy actually may not be very effective to change the migration decision of the adults, but they actually change the migration decision of the parents, of the children. Okay, so at
you
last,
are almost out of time, Joan. You're almost out of time, just to let you know.
Yes. Okay. Thank you. So at last, I want to list the three contributions for this study. And so one of the so the first is we estimate the migration policy because we estimate the immigration policy. So most the existing literature actually estimates the migration policy for international migration. And what we do here is that we estimate the migration policy for internal migration. So our study would be also add more values for the internal migration policies for developing countries, because the welfare impact of the internal migration policy in developing countries is oftentimes overlooked. And the last contribution is that there's now an increasing attention to the detrimental effects of parental absence for children's outcome. And so the large population of this left behind children in China has posed a challenge to human capital accumulation and economic growth sustainability in China. And our paper actually has a very important policy implication that providing migrant children, that says that providing migrant children in the city with access to public education resources could be an effective way to solve the issue of left behind children. So that's all of my sharing. Thank you very much. I think you forgot to open your microphone.
Oh, okay. Yes. Thank you very much for noticing that. Yes, what I was saying is that we have time for maybe 1 or 2 questions. If you want to go ahead and just ask your question, please unmute yourself and go ahead. Just a quick question. Perhaps for the future, but do we know how those children left behind fare? Do you have access to data to assess how the children fare, those who are left behind?
You mean how the
the detrimental effects, like in this slide, you talk about detrimental effects.
Right. No, our paper do not estimate the detrimental effects of this.
Yeah. Okay.
For left behind children, right? We only affect the impact of the policy on whether the children is left behind or not.
Left behind. Very good. Okay. If there are no questions from the audience, then I suggest then that we move on to the next paper. Thank you very much, Joan.
Thank you. Also, thank you. Let me close my screen.
Yeah. Sure.
Okay.
So our next speaker is Andreas. I believe he's here. Yes, perfect.
Yeah, he's here.
Please
Hello.
go ahead.
Yeah,
hello.
Wait a minute.
Perfect.
So, I guess you see my slides.
Yes.
If not, then please interrupt me. Otherwise, welcome from my side, and thank you very much for attending my little presentation of the paper "No Man is an Island." That is joined with. So my name is Andreas Nicklisch. I'm from the University of Applied Science of the Grisons. That's in a small university in Switzerland. And I'm representing here a larger group of researchers mostly from the University of Hamburg, who worked on Syrian refugees and their behavior in Germany. Now, the starting point of this entire project, so this paper here is part of a larger project, was the observation of us that in the late 2010s, we had a mass immigration, mostly from Syria, but also from other developing countries to Central Europe, most prominent to Germany and to Sweden. And at the same time, one could see that there is a massive increase in the anti-immigration ressentiments, and the political parties opposing this immigration were increasing their power quite tremendously. By the way, if you have any questions, please interrupt me. I can't see the chat here. So what we want to do with this project is to replace stereotype with some knowledge. It's not that we just want to see fairy tale country where everything is fine and people come and they perfectly adapt. No, what we want to do is we want to use the methods that we have as economists to see how people interact. How refugees interact with hosting nation people, and how hosting nation people interact with migrants. In particular, we want to use experimental economics here, because if we do so, we have the chance to let people really reveal their preferences for their true money. So maybe it's a bit focused on the monetary effects of interactions, but nonetheless, it's not cheap talk. Now, what we want to do in this study here, or what we did in this study, is to see how trust and trustworthiness evolves among the participants of the study, meaning we focus here on the Syrian refugees, and these Syrian refugees now live in Germany. There are about 140, and we have groups for comparison. So we have people in Jordan, Jordanians, we have Germans, but here in this talk, I totally focus on the Syrians. Now, if we want to see how people socialize, it's a good idea to have a look at sociology, and sociology stress the pivotal role of two strategies, how newcomers form ties in a new environment. And these two strategies are called either having a bonding network or a bridging network. Now, what do I mean by a bonding network and a bridging network? This goes back to Putnam 2000. Well, if you have a social network that follows the bounding strategy, then you go and see most likely those people who are among your peers, meaning in our case, you see many other refugees. This has quite a lot of advantages. Those other refugees have maybe some advantages of prior experience. They tell you how to do this and that in the new country. But at the end of the day, you do not typically found ties to other people apart from your own peers. How do you form these groups? Well, basically, you go to mosques or to support groups or to international cafes and so on and on. And there you meet your own people and you discuss problems with them. Now, the other strategy is called the bridging social network. And in bridging social networks, you search actively for new ties to either the host nations or completely different peoples. For instance, you could go to sport clubs, you could go to the firefighters. Here we have this famous picture from a person from Ethiopia who joined the firefighters in Germany. And this is, of course, something very different. Here you form ties with the other people. They could also help you, but first of all, you have to cross certain problems. Maybe you have to cross the language barrier. Maybe you have to cross certain stereotypes. So actually, this needs a bit more effort. And what we want to see is how this behavior, so the network that you form, how this interacts with your trust when facing another person from your own peer, meaning that you're a refugee and you you're asked to trust another refugee from Syria, or if you're asked to trust another person from the hosting nation, meaning in this case here, a German participant. Now, since I have very little time, I can only tell you the very rough idea. People play a trust game. In this trust game, people are endowed with money. They send a certain amount of money or not. They can choose off. They play this in a strategy method, which means that we ask them for every possible outcome of the game, how they behave in this situation. Now they send the money or not. If the money is sent, it's tripled, and then there's another person, that's the trustee, and this trustee can freely decide how much to return. Now the amount of money that is sent in the first place is called the trust, and the money that is returned is called trustworthiness. Notice that we play the strategy method, and this means that we know how people respond if they receive as a as a receiver, how people behave if they receive 0, if they receive 3 times 50, which is 150, if they receive 3 times 100, which is 300, or if they receive 450. And this allows us to estimate a response function, and from that we get two types of information. The first information is that is what we call unconditional trustworthiness and conditional trustworthiness. But I come to that later. Notice also that people get these points here cashed out later on at a exchange rate. But this is not so important. It's just important that they play for their real money. Half of the participants from the Syrian side played with Germans, the other half played with Syrians. Now, if you have a look at this picture here, this shows you the trust. The important thing is that you see from the left to the right-hand side, the Syrians' behavior when they face a Syrian or a German, and the social capital, the strategy that they apply. It's either bonding, which is on the left-hand side, meaning that they interact mostly with their own peers. And then we have, of course, others who do both, bonding and bridging. And then on the right-hand side, we have people who only bridge. Now, what you see is something that is not so good news for those who claim that assimilation is a good strategy for the refugees, meaning that you see definitely a strong, significant effect of having a bonding capital or a bonding network. And this means that you're more likely to, or significantly more likely to trust when you have a bonding capital. On top of that, you see here the discrimination of your interaction partner, meaning that you would trust more when you face your own peer than a person from the hosting nation. Although this is not significant, we can even find this for the for the bridging capital. Now, let's jump to the second thing, to the second observation. That's the unconditional trustworthiness. You can think of this as the absolute term of a linear regression that we estimated for the 6 possible responses of the person who has returned on the hypothetical amount of money that they receive. So unconditional trustworthiness basically means that they send. This is something like the money that they return without even having received some money. And here again, you see a very similar picture to the picture that we just saw. Again, people with the bonding capital are more unconditional trustworthiness, and people from Syria have this peer effect. Now, from our perspective, most important message is this here. This is now the conditional trustworthiness, and this is basically how much of a dollar of the money that you receive, you return. And what you see here is, of course, also again, our significant difference between facing a Syrian peer or a member of the new hosting nation for all the three groups, regardless what kind of social capital or social networks they form. However, the difference or the discrimination between Germans and Syrian interaction partners is for bounding far higher. So at the end of the day, I'm running out of time. There's no black and white here. On the one hand side, we have with bonding social networks, people on one side favor the in-group far more. However, they trust significantly more. On the other hand, with the bridging network, they discriminate less. And so at the end of the day, we have to say what kind of behavior do we want as the members of the hosting nation. So on the one hand, we could facilitate more trust, which means that they discriminate more. But on the other hand, if we don't want to have discrimination, then people tend to trust less. Just a final remark, what is important for who bonds and who bridges, on the one hand side, it's the length of the stay, but even more shocking to us was the private housing. So the private housing is very important for the refugees. If you have private housing and not people who stay in camps, then bridging becomes more likely. And since I have very little time left, that's all I have to say for this article. If you want to see more, please have a look at the paper. And I'm also happy to talk with you about my research or our research. Thank you very much.
Thank you, Andreas. We have time for 2 or 3 questions. If you want to go ahead and ask, please just unmute yourself.
I just had one little question. As far as the language barrier when refugees come, I mean, how does the bridging, how does that work? I mean, like, does this Syrian refugees, when they come, are they proficient in German, or is there some common denominator?
No. It's mandatory to attend a language course, but that's only the starting point. Bridging activities more means that you go to a football club, or in particular, your kids go to the football club. Now we have another project that talks about the role of the kids in the assimilation process, and they are key because they learn the language quite easily, and they have far more bridging contacts than bounding contacts, and this is some kind of door opener. But we are currently working on that. But the language barrier is for the adults a huge problem. That's true.
Could I just ask about, sorry, I didn't understand the experiment. So what's the incentive in the experiment for a refugee to send money?
Well, basically you can earn up to 20 euros.
Okay, I see.
You get some endowment, and then you may send or may not send the money. So they actually play for real money. So we formed. So it's not that easy to get in touch with the refugees. So we have a Facebook group which offered some help, and by this we recruited refugees, and so we formed a network throughout Germany. And from this network, then we recruited people. And the Germans, for instance, they are ordinary citizens, either from Germany, from Hamburg or from Leipzig, which is also in Germany.
I mean,
but they play for real money. basically.
Yeah, sure. I mean, I was just thinking that when you're refugees, then if you get some money, everybody is kind of trying to help. You know, I get this kind of thing, especially from the Ukrainian case with my colleagues at Kent and stuff, where you are. It's not necessarily that you are looking for a return. You are just kind of sending the money to another refugee because you think they can, you know, they can use the money in a way. So it's more kind of what's the word?
Empathy, maybe.
Sorry?
Empathy?
Empathy, exactly. Yeah. So it's more
Yeah.
like that element rather than in return.
So, I mean, I don't have time to talk about the German response behavior, but it's not that different from the response behavior that we observe in other experiments where they play with among themselves. So those participants from the German side, they are, let's say, semi-professional participants of those questionnaires. So they do this not for their living, but they earn money with this part-time job here. So it's not that they just basically send the money and don't care. That was important here in this experiment to rule this out.
Thank you.
Okay.
Yeah, very interesting. Thank you very much, Andreas. And let's move to the next paper.
Okay.
The next
Goodbye.
paper will be. Okay. Thank you. The next paper is by Robert. You can share your screen, Robert, and go ahead.
Hi, can everyone hear me and see me?
Yes.
All right, great. Let me just see if I can share my screen. 1 second. I have to find the right window. There are a lot to choose from, unfortunately. Here we go. All right, can everyone see this?
Yes.
All right, great. I'm Robert, and my co-author is Professor Wanava, and this is our paper in the latest issue of the Journal of Population Economics, that's asking about citizenship increased labor survey non-response. So as a quick overview, in 2018, the Trump administration attempted to add a citizenship question to the 2020 census. This was blocked by the Supreme Court in 2019, but this whole episode increased the salience of citizenship questions in surveys and censuses for researchers, policymakers, and politicians. People have noted that other American surveys do and have for quite a while in some cases featured a citizenship question. One of these includes the Current Population Survey, of course, the main labor survey in the United States, which has had a citizenship question since the 1994 survey redesign. We studied the CPS citizenship question using Current Population Survey microdata from the NBER from 1989 to 2002. As a quick preview of our results, we found that the 1994 survey redesign as a whole is associated with a large, discontinuous, persistent, and immediate change in survey refusals, where refusals went up by approximately 30% as soon as the redesign was implemented. In a panel regression after the redesign was implemented, we see that controlling on demographic factors, a variety of fixed effects, we find that there is a positive and significant relationship between a state's non-citizen population in that month of the survey and the state's refusal rate in that month of the survey. Our most compelling evidence for the effect of the citizenship question itself is that states with larger populations who are exposed to or vulnerable potentially to immigration concerns experienced distinctly larger increases precisely at the time of the redesign. Therefore, in light of all these findings, we propose that there be greater scrutiny of the effects of citizenship questions on survey and census data. So a quick review of the literature. When the census citizenship question was being considered, there was a good deal of research studying this question. The CBAMS, Census Barriers, Attitudes, and Motivators studies found many potentially concerning results. In focus groups, people identified that the citizenship question was something that they thought was racially biased and charged with attitudes that they thought were potentially discriminatory. And many people reported that they would consider participation. In the survey question version of the CBAMS, they did not have time to add a question about the citizenship question in particular, but they did find widespread evidence that people are concerned that information collected in a census will be potentially shared by government agencies or could even be used against a person in some sort of legal proceeding. The United States Census in particular was studied with a couple of papers by Brown et al. And Baum et al. These papers found that if the citizenship question had been added to the census, then it would have decreased the response rates of immigrants and Hispanic people. Citizenship questions and immigration's results and interactions with citizenship and surveys have also been studied. For instance, in the American Community Survey, the citizenship question consistently has the highest rate of item non-response of any question on a survey. Researchers have also found that non-response is higher in the panel study of income dynamics, PSID. I may have misremembered that acronym. The key idea is that the PSID immigrant segment has a higher non-response rate. Additionally, work has found that immigrants were less likely to be contacted by surveyors and, given being contacted, less likely to participate in surveys in Denmark. These issues are enhanced in their importance because non-response has increased dramatically in quite a few surveys. In the current population survey, non-response approximately tripled from 1998 to 2000. Non-response has also been associated with rotation group bias with mismeasurement of the poverty rates, and in a forthcoming paper that I'm co-author on, also mismeasurement of labor force participation rates. So our first methodological regression setup is what we call our survey redesign event study regression discontinuity. In this file, our key variable and coefficient highlighted in maroon is beta-2 post. And this variable is designed to identify the effects of the 1994 redesign as a whole on non-response. However, it doesn't yet say anything about any particular question or feature of the redesign survey. What we see is that the variable for post is highly positive, highly significant. And if we shall move to our graphical analysis here, we can see that the increase in survey refusals and type A non-interviews more generally, which is a broader case that includes refusals, we can see that there is a distinct and persistent and large increase in survey refusals occurring directly at the time of the 1994 redesign. Our next methodological contribution is what we call direct panel regressions. In these regressions, in addition to a variety of fixed effects and demographic controls, we use a state's non-citizen population in that month as a control to explain refusals. We do not claim that this regression is completely identified, though we feel that with the large amount of controls that we have, it provides compelling evidence in support of our hypothesis. As you can see in the table highlighted, there is a significant and large increase in survey refusals associated with a state having a greater non-citizen population. Lastly, we use an event study difference in differences approach. Because the treatment is sort of the redesign as a whole, which was implemented uniformly across states, when we categorize treatment and control states, we categorize them not by the redesign being applied to one or the other. We categorize them by having greater populations that are potentially susceptible or maybe concerned about the citizenship question. Across 5 factors, which include the population of Hispanic people in that state, the population of non-citizens in that state, the population of people born in Mexico in that state, the population of people born in the United States in that state, and also a proxy for citizenship question item non-response. We categorize states by these categories and then assign to the control group states that rank in the top 20, 15, or 10 in at least 3 of these categories. Sorry, that would be the treatment group. And then states that rank in the bottom for at least 3 of these categories are assigned to the control groups. All of our models then include a variety of fixed effects and demographic controls. Our coefficient of interest is beta 3, which is a coefficient on the interaction of the post-1994 variable with the treatment state designation. This variable tells us the additional increase experienced by the states with larger populations potentially susceptible to or concerned about the citizenship question occurring precisely at the time of the redesign. We can see that across different samples, which are selected by different stringencies in the rankings, that there is a consistent, positive, and significant increase in the treatment states' increase in refusals at the time of the redesign. So to discuss our findings and interpret them and consider the policy implications, the 1994 redesign across all of our specifications and models, including both state and national data, the latter of which we presented earlier in the slides, show that there is approximately a 0.7 percentage point increase in refusals. This amounts to about a 28% increase, which happened effectively overnight. From our direct panel regressions, we estimate that for every 100 non-citizens observed in the data in a state in a particular month, a state will have about 6 more households refused on average. Lastly, in 1994, we found that treatment states experienced approximately a 1/4 percentage point greater increase in 1994 than the control states. Now, we can compare those 0.25 percentage points to the 0.7 percentage points, which tells us that the citizenship question concerns appear to have contributed a sizable amount to the overall increase. However, it appears that the survey redesign caused greater refusal rates for other effects as well. Now, there are several important and nuanced policy considerations. From reviewing the literature and our own evidence, seems that citizenship questions cause anxiety among potential participants and can contribute to distrust of surveyors. Reductions in response caused by these questions can then harm survey representativeness and inclusiveness, and also increase costs and, of course, throw into some doubt the quality of the data obtained therein. However, it is possible that there can be valid reasons to study citizenship, such as to assess the integration of immigrants into labor markets and to banking potentially, or possibly into education or other aspects of society. And so we may validly want to study these and therefore want to obtain data on non-citizens so we can assess their integration into components of society. And so this gives us a difficult trade-off. In order to study non-citizens, we may have to know who they are, but the act of finding out who they are can hurt the quality of survey data as well. So I would like to thank my co-author, Professor Wanava, who is on this conference, and also thank the editor-in-chief, Klaus Zimmerman, for graciously allowing us to present here.
Thank you very much, Robert. Great presentation. Questions? We have time for a couple of questions.
Just quickly, I mean, so what is exactly the question? Are you a US citizen or not? That's the extent of it?
Yes, that's the gist of the question.
So if you say no, then is there a follow-up thing?
I believe there's a cascade of a couple more questions that can follow from it. I think they don't ask about documented or undocumented status, but the question logic is nested in a wider group of questions.
I mean, your prior, I suppose, was that non-documented are the most likely to be nervous about it, right?
Yes, they would be most likely.
So in a way, I mean, this kind of survey, I mean, I'm being devil's advocate. I mean, this kind of survey is picking up mostly non-documented migrants. Would that be a wrong thing to do?
I don't understand the question. What do you mean by picking up?
So if you are not responding, then it is likely that you are not non-documented. Let me put it the other way. I was a student many years ago in the US, but I can't remember now. Are the students also surveyed in the census or not?
So we study the current population survey, which surveys technically at the address unit. There's effectively a giant list of addresses where people might live in the United States. And then approximately 60,000 of them are chosen according to a rather complex stratified sample design every month. And so it is definitely possible that students could be surveyed in principle.
Okay, so it could be that if I am a student and I see the citizenship question, then I say, okay, it's not for me. The survey is meant for students, for citizens. That could also be one of the reasons.
That is also another reason.
So the other thing that can happen is even if they're putting their papers in place, they're afraid when you ask them a question about, even though they could be legally in the country, but still feel like hesitant about saying anything about it.
Yeah, I'm trying to kind of understand the reason behind it in a way. I mean, that's, I mean, I know you can't capture that, but I'm just trying to kind of figure out why would people be reluctant to.
So, I mean, so that's the reason why we looked at the different specifications. I mean, we looked at those states which had higher minority populations, so forth and so on. And as you can see, what we found is that there is less response from those states. So in other words, so the implication here is that whenever you raise a question like this, people may not be really honest about coming out and answering. I mean, there are two things that can happen. One thing is they can refuse to answer that question. The next thing is they might refuse to answer the whole survey. And then that is where the problem is. Just to skip the whole survey, then all of a sudden we are not getting a good information from the ground.
So from the point of view of Hispanic households, if you have a Hispanic household that has citizens and undocumented immigrants, then you might be missing some citizens of Hispanic origin, and that might be, systematically underrepresenting some Hispanic citizens, for example.
Mm-hmm. Exactly, and
we found
very strong results for Hispanics. I mean, those states where a dominant Hispanic population.
It's a very good point, because the survey is done at the address level, which then becomes the household level, assuming people are present at the address that's surveyed. And therefore, there may be a mix of citizens and non-citizens in any particular household. And therefore, if refusal occurs at the household level, which it does, then we may be seeing people who themselves are citizens refusing to take the survey on behalf of family members or close friends who are living with them or living close to them or nearby them on their behalf. And so we could also see refusals that would undercount citizens as well, and people here who are here perfectly legally too.
So let me interject and suggest that we move on to the next paper. The next paper is by Christina. Thank you very much, Robert.
Thank you.
How you doing? Yes, I have my How you feeling?
Okay. Can you see the screen?
Yes.
Okay. So good evening. Thank you so much for providing me the opportunity to briefly introduce this paper. So the paper I'm going to present is on the effect of economic preferences on attitudes toward immigration. And this is a joint work with Matija Kovačić from the Joint Research Center of the European Commission in Istra, Italy. So basically in this paper, we are interested in exploring whether some specific economic preferences, namely long-term orientation and risk aversion, affect the formation of attitudes toward immigrants. Well, why we think that this is a very interesting and relevant topic? Well, because as you know, I imagine immigration is a crucial and relevant topic in the public debate, in the politics debate, in politician debate. And public opinion of immigration may influence from one side policies implemented by government, but from the other side also immigrants' position within the host societies. So due to, and this is demonstrated in many papers, I reported here some of them. So due to the importance, the relevance of public opinion toward immigration, it's important also to understand a little bit more about the potential determinants of attitude toward immigrants. So there exists an extensive literature looking at the relationship between socioeconomic and demographic characteristics like occupational status, education, and so on, and the formation of attitudes toward immigrants. So there are also a strand of literature looking at the impact of specific cultural traits or national pride, the impact of this factor on attitudes. Well, we think that also other personal individual traits like patient and risk preferences in this context may play an important role in shaping public opinions about immigration. And specifically, which are the mechanisms we have in mind that can relate, let's say, economic preferences and attitudes toward immigration? So first of all, we can say that it's a kind of matter of cost and benefits related to the immigration phenomenon. The cost of immigration tend to incur in the short run. So cost related, for instance, to the competition in the labor market, for instance, cost related to difference in terms of wages. So all this kind of cost incur in a short run perspective. And this was demonstrated in many papers. Here, I reported some of them. So starting from this evidence, it's plausible to think, let's say, that individuals with a lower discount rate, so individuals would tend basically to delay gratification, may put less weight on this immediate cost. And as a consequence, they are also more favorable, let's say, to admit immigrants. So they have more favorable attitudes toward immigration. And this is the first mechanism we have in mind, the first hypothesis of our study. The second one is related to risk aversion. So in this case, it's plausible to think that individuals who are generally less inclined to take risks, so more risk-averse individuals, who have, as a consequence, also a lower level of tolerance for losses, may put more weight on economic and cultural risk related to the immigration inflows. So these are the two mechanisms that we have tested through our empirical exercise. So what we have done in our paper? First, we have estimated the direct effect of time and risk preferences on individuals' opinion about immigration. So we use individual level data coming from the European Social Survey, and we select let's say, an extensive range of questions related to opinions about different aspects of immigration: economic impact, cultural impact, also policy impact in terms of the degree of acceptance of new, for instance, immigrants from different areas in the world. So we use this variable as outcome variable for our model. And then we try to understand what is the effect of risk aversion and long-term orientation on these outcomes. We have a problem in terms of endogeneity in this case, because we have in the European Social Survey a set of variables regarding economic preferences. But of course, economic preferences from one side and the attitude toward immigration on the other side come from the same survey, are detected simultaneously, let's say maybe co-determined better, and this can, and there could be some unobservable factors that affect simultaneously the two aspects, the two factors. So in order to address this potential endogeneity, we exploit a set of historical ancestral variables. And this variable may have influenced first the emergence of preferences and also the transmission, the intergenerational transmission of these preferences. In particular, we use two blocks of variable. The first block is for long-term orientation. So these are a set, let's say, of historical variables that approximate long-term orientation, come from the paper by Galore and Dodza. The second block of variable regard risk preferences, and we use specifically a linguistic marker that was introduced in the paper by Kovacic and co-author, in which they basically create this marker starting from the grammar structure or different languages, able to capture, let's say, the uncertainty that specific languages expresses. I will go back, I will explain more in detail this marker later in the presentation. So just a spoiler, what we found in our analysis is what we expected, basically, so that these intergenerationally transmitted ancestral characteristics have a significant impact on attitude toward immigration. In other words, more patient and less risk-averse individuals tend to be more tolerant toward immigrants. I would like to spend just a couple of words about the description of the ancestral characteristics. For long-term orientation, we have selected a set of agroclimatic characteristics conducive to higher return on agricultural investment. And specifically, we have our variables of interest are 4 and are related to the crop yield potential and the growth cycle. So growth cycle is basically the number of days elapsing from the planting to the harvest. And we have these two measures for two different historical periods, for the period before the discovery of America and for the period after, just to take into account, for instance, for the different spreads of crops around the world and also for differences in terms of technology and so on. Together with these 4 crucial measures, we include also in the model a large set of geographical characteristics: precipitation, altitude, latitude, and so on, all the variables included in the Galore-Olzak paper, basically, to control for factors that can potentially affect the intergenerational transmission of these characteristics. For risk preferences, we use a linguistic marker named El-Bialy's linguistic marker, and the intuition behind these markers is very simple. I mean, the construction is a little bit more complicated, but just to be clear, this marker basically captures the intensity that a specific language in which a specific language uses non-indicative verb tenses in order to describe a situation of uncertainty. So imagine that there exist in the linguistic field 6 different contexts in the grammatic structure, let's say, of languages regarding the description of uncertainty. We basically count for each specific language how many contexts requires the utilization of a non-indicative mood. A higher value of this marker describe a higher risk aversion of speaker of that specific language. And then we control for a set of other variables that I will explain later in the presentation, like long-term orientation and uncertainty avoidance from the hosted data set, and the risk-taking measure provided by Folk and co-author in my paper. We use the epidemiological approach in the sense that we focus on a sample of second-generation immigrants in order to isolate the effect of culture, to try to isolate the effect of the intragenerational transmission of preferences. And our main findings are summarized here. So first of all, we find, as I already spoiled before, that historical agroclimatic and linguistic factors that contributed to stronger long-term orientation and lower risk aversion significantly increase the degree of tolerance toward immigration. This is the direct effect that we detect by regressing simply the ancestral variable on the on the attitudes toward immigration. We find also that less patient and more risk-averse individuals are more concerned about the economic consequence of immigration and the entry of poorer immigrants. So these are two specific dimensions captured by two questions regarding, let's say, public opinion toward immigration. So it seems that it's more important the economic aspect and the aspect regarding the entry of poor immigrants in the European context. Then we perform a set of heterogeneity control, and we find, for instance, that the effect of time preferences on economic concern is significantly reduced for low and medium skilled workers compared to the others. And finally, this is an important point because it's a step further in our analysis. We try to estimate also an indirect effect of the ancestral characteristics that approximate long-term orientation and risk aversion. We try to capture the indirect effect of this variable. In which way? So basically, we estimated an IV, a set of IV for both, of course, the outcome, in which we use the ancestral characteristics as instrument for parental long-term orientation and risk aversion measured in the contemporary environment. So using these two preferences at the parental country of origin coming from the data set provided by Hofstede in his seminal work. So this is the idea. We estimated, we perform, let's say, this specific exercise in order to show that there is an effect of ancestral characteristics, an indirect effect that goes through these parental, let's say, preferences and affect indirectly, let's say, our outcome variable, so attitude toward immigration. This is an important element contribution of our paper. And then we perform, out of time, Christina. Okay, we perform a set of robustness check, and we use an alternative definition of second-generation migrants. For instance, we include also dummy capturing the massive immigration inflows during and after 2015. So our results are robust to a comprehensive set of robustness check. Just to conclude, why we think that our contribution may be interesting for academics, researchers, policymakers, maybe. Why? Well, because first of all, we have offered, provide an alternative approach to estimate the effect of economic preferences using historical and cultural mechanisms. So it could be, it's something that it was applied, let's say, in a new context, in the context of attitude toward immigration. So this is one of the contribution of our work. And secondly, we confirm also the importance of immigration-related cost-benefit trade-off for tolerance. So we contribute to this trend of literature. And finally, we provide also interesting potential channels that link preferences and political attitude toward extreme parties. As I told in the introduction, in the beginning of the presentation, of course, the immigration is a very hot topic and it's often used by extreme political parties by propaganda activities, let's say. And thank you so much.
Thank you very much, Christina. Questions? We have time for one, maybe two questions. So I am still wondering about the mechanisms. Can you say a word about which type of mechanisms you have in mind?
Yeah, we have in mind two mechanisms, basically. The first is related to the economic preference, the long-term orientation. So the idea is, okay, I can go back to the slide. Okay, the mechanisms are related to the cost and benefit of immigration. So basically, the cost of immigration tend to incur in the short run, so our short run cost. And this is demonstrated by many work, by many papers, let's say. And for this reason, this is the key point that then affect our, let's say, our two mechanisms, basically, because if the cost of immigration tend to incur in the short run, less patient individual, for instance, tend to put more weight to this cost, this immediate cost, and don't see, the long run benefit deriving from immigration. Okay, this is the first mechanism. The second one is related to risk aversion. In this case, more risk-averse individual have also a lower tolerance for losses, as demonstrated, as shown in the paper by Boning and co-author. And again, as a consequence, they tend to put more weight. It's reasonable, at least, to think that they put more weight on economic and cultural risk related to immigration. So this is, these are the two mechanisms.
Okay, I don't see any other questions. So yes, sure, please go ahead, Madeline.
So, I read all of them, and this paper was one of the most mind-blowing ones of the year to me. They were all fascinating, but this one just stunned me, I think. And so I'm curious, if you were a politician who wanted to increase support for immigration, what do you do in this case? Because the mechanism here is, this generations back ancestral gene, in essence, that's affecting people's attitudes. So what's the policy implication?
It's a very good point, a difficult question, because I think in practice, honestly, I don't know. But in theory, I think that my idea is that the policymakers should try to design, let's say, targeted policies depending on the context in which these policies are implemented. So it's difficult. I mean, I think that they should have to take into account of this heterogeneity in terms of attitudes and try to implement a specific intervention depending on the cultural context also. But I mean, I think it's really difficult. it's really difficult to think about policy intervention in this sense, but maybe it's the only, I mean, policy that I have in mind is to try to be more, let's say, to implement a targeted intervention. So depending on the context, on the cultural context, so on difference in terms of culture.
Okay, very good. So I suggest we, oh, sorry. You were going to say something, Christina?
No.
Oh, okay, perfect. So let's just adjourn and thank all of our speakers. Thank you very much for a great job. Very interesting session.
Okay,
and
thanks so much, Alfonso.
I guess, yes, you're welcome. My pleasure. It's been my pleasure. And there is a break, and I believe you will reconvene at 10 p.m. Central European time.
Exactly. Thank you very much.
Bye, everyone. Bye, class.
Thank you.
Bye.
Bye, Madeline.